I've been having technological issues since my meeting with Hoyer at 8:15 this morning. Okay, let's try again. Committee on Transportation Infrastructure will come to order. I ask unanimous consent, Chair be authorized to declare recess at any time during today's meeting without objection, so ordered. Since it's been a while since we last met, we have several new members. I would like to briefly remind everyone about safety rules and remote proceeding regulations. Member staff and all others physically present in this room are informed that masks must be worn at all times during today's proceedings per orders of the attending physician. The chair views this as a safety issue, therefore an important matter of order and decorum. Assert my responsibility to preserve order and decorum with respect to wearing a mask. Chair would greatly prefer that all present simply uphold decorum. However, I will take action if you don't. I'm not going to read all the script. For members participating remotely, I'll remind you of key regulations, House Committee and rules. Members must be visible on video to be considered in attendance and to participate unless experiencing connectivity issues. Members must be visible on video to count for a quorum and to vote. Members must also continue to use the video function for the remainder of the time they're attending the meeting and hearing unless experiencing connectivity issues or other technical problems. If members experiencing any connectivity issues or other technical problems, please inform the committee staff as soon as possible so you can receive assistance. Chat function is available for members on the Cisco WebEx platform. For this, members also call the committee's main phone line, 202-225-4472 for technical assistance. Members may not participate in more than one committee proceeding simultaneously. However, for security reasons, members may maintain a connection to the software platform while not in attendance. It is the responsibility of each member seeking recognition to unmute their microphone prior to speaking and keep their microphone muted when not speaking to avoid inadvertent background noise. As chair of today's meeting and hearing, I will make a good faith effort to provide every member experiencing connectivity issue opportunity to participate fully in the proceedings. To insert a document into the record, please have your staff email it to documents tndi@mail.house.gov. And with that, welcome to the organizational meeting of Transportation Infrastructure Committee for the 117th Congress. Thanks everybody for being here today. Despite the challenges of the last Congress, I think we were one of the most productive committees. Literally the last thing adopted in December for the omnibus package was the Water Resources Development Act. We had worked out all the issues with the authorizing committee, but then when it got attacked onto appropriations, we had to deal with Senator Shelby's staff, and they had all different issues, and it literally was the last thing. But we got it done. We will access the trust fund, not as rapidly as I had proposed, but we are going to spend down the taxes that have been collected from the American people for harbor maintenance on harbor maintenance. Yet? What?
I can hear you, Grace.
Well, has the budget started?
What, Grace?
I don't hear them.
We're in session.
I think they're working out some technical difficulties.
Oh, okay.
He was having some problems with the mic.
And Julia, you're on twice. How did you do that? I'd like to find out.
Hello?
Easy, but it's not.
Hi, Grace. We're here. We're in the meeting.
Yeah, of course.
She has a question.
Hello, everybody.
Hello.
How are you?
I hate COVID.
I thought I was late.
I'm not repeating everything. You all know it anyway, if you didn't hear it. What are we doing? Well, okay. I know, they don't need that, so we're not going to repeat it. Earth to committee, can you hear us yet?
No. We can hear you.
Oh, you can, all right, okay, all right.
Can't see you, but can hear you.
Well, I can see you and you don't need to see me. Okay, so we're back. I'm not going to repeat. Apparently you didn't hear everything I said, but you've heard it before, so don't worry about it. in any case, I was talking about the successes of the last Congress, and I was saying that the Water Resources Development Act was the last thing added on Sunday late to the omnibus package, and we will begin to, in a measured way, spend down the accumulated taxes on overdue maintenance for the nation's harbors. So that was a big step. Coast Guard was also included. The aviation safety bill was included, and pipeline safety. So I think our committee, contributed a great deal to the last session of the last Congress. And I look forward to working with everybody and building on that as we address the complicated transportation infrastructure challenges that affect all Americans and all the new challenges that have come in a time of COVID, which we'll get to a little later in today when we go into the hearing. Today we're meeting to introduce new members of the committee, adopt the committee's rules, appoint subcommittee chairs and ranking members, appoint members to subcommittees. First of all, welcome to new members. TNI continues to be a sought-after committee. In this Congress, we grew to 69 members, 37 for the majority, 32 for the minority. I think we still have seats for everybody. And the new Democratic member who is not new to Congress, but joining the committee for the first time is Seth Moulton. I don't know whether he's here or virtually or if he's here at all. Is he on the screen? Hey, Seth.
And thank you. Honored to be here.
He joined us from Massachusetts, and after serving the Marines, serving 4 tours in Iraq, he worked in the rail industry and as the managing director of the Texas Central Railway, and will bring real expertise on high-speed rail and rail issues to the committee. Freshman Democratic members who'll be joining our committee are Representative Jake Auchinloss. Jake is also a Marine from Massachusetts, commanded infantry in Afghanistan, special ops in Panama while serving. Prior to his election to Congress, he served on the Newton City Council and chaired the Transportation and Public Safety Committee. Rep. Carolyn Bordeaux hails to the committee from Georgia, no stranger to Congress. Early in her career, Rep. Bordeaux was a legislative aide to Senator Wyden from my home state of Oregon. She also served as a professor at Georgia State University and was the director of the Georgia State Senate Budget and Evaluation Office. Welcome, Carolyn. Representative Kai Kahale, first member from Hawaii since Mazie Hirono moved downward to the Senate. He is 18 years a veteran pilot and commissioned officer in the Hawaii Air National Guard, commercial airline pilot with Hawaiian Airlines, and served as the Hawaiian State Senate Majority Floor Leader. Welcome, Kai. We look forward to you applying your aviation expertise. Rep. Marilyn Strickland. Rep. Strickland joins us from Washington, is the first African-American to represent Washington State at the federal level, and the first Korean-American woman elected in Congress. Congratulations, Marilyn. Prior to her election to Congress, she served as mayor of Tacoma, where she was instrumental in investing over $500 million in infrastructure, creating over 40,000 new jobs, and totally transforming Tacoma from a rather blighted past into a sorry, there's some other nice places in Washington too. Representative Williams, Nikema Williams, joins us from Georgia, where she represents the Atlanta region, served in the Georgia State Legislature, and is the first Black woman chair of the Democratic Party of Georgia. She led the fight to expand access to opportunity for Georgians. Congratulations and welcome. And last but not least, Rep. Marie Newman from Illinois. She's joining us from Illinois, passionate about modernizing infrastructure, address the threat of climate change, make service options more affordable, accessible, and equitable. Before election to Congress, she founded the worldwide nonprofit Team Up to Stop Bullying. And finally, I would like to recognize Representative Sharice Davids from Kansas, who will be the full committee vice chair. Welcome to our new members of the committee, and welcome back to our returning members. And now I recognize the ranking member, Mr. Graves, for his statement.
Thank you, Chairman Fazio, and I do want to congratulate you on being selected committee chair again. In the last Congress, I think, and you pointed out, that we demonstrated that when we work together, this committee can accomplish a lot of good things for the American people, and we all agree on the importance of our country's infrastructure. As the economy continues to deal with the impacts of the pandemic, I think our work here is even that much more important. If we work together this Congress, we can accomplish many more positive things for the nation. And our returning members, they all know this about the committee, and I welcome them all back again this Congress. And I also want to welcome our new members, and I'm happy to say, and you mentioned this as well, that we've grown to 69 members, which I think is a testament to just how desirable a seat on this committee is. But I do want to welcome our 10 new Republican members. Tim Burchett, Tennessee, who's no stranger to Congress, obviously, but new to the committee. Dusty Johnson from South Dakota, also new to the committee. Jeff Van Drew, New Jersey. No stranger to Congress, but new to the committee, and Michael Guest of Mississippi. And our new members, or freshman members that are here, Troy Nels of Texas. We've got Nancy Mace of South Carolina. Nicole Maliatakis of New York. Where's Nicole at? Is she here? Beth Van Dyne of Texas. Beth's over here. Carlos Jimenez of Florida. And then we've got Michael Steele of California. So I think giving, Michelle, I'm sorry. I think given the members you mentioned and our members, we've got quite a diversity on the committee, and a lot of expertise, a lot of people that have either worked directly in transportation or in their previous careers, did a lot in when it comes to infrastructure. But I look forward to the positive contributions and the new perspectives that all of our new members are going to bring to the table, along with the continued contributions of our experienced returning members. And with that, I will yield back.
I thank the gentleman. One thing I neglected in opening, they have developed computations for square footage. I think they should look more at cubic footage, but they're looking at square footage of rooms, and they've calculated that we can have 33 members in the room at a time. So and there's 69 of us. So for future hearings or markups, we would appreciate it if people would notice us ahead of time, whether they intend to be here virtually or in person. And then if we have excess, we will attempt to deal with that in the best ways possible and as equitably as possible. I'll talk to staff about perhaps, I don't know if we can link in the room right above us and people could be in there and people could rotate up and down. We'll work on it and figure out some way to deal with it. Okay, now the first order of business for the committee's consideration is adoption of the rules of Committee on Transportation Infrastructure for the 117th Congress. An electronic copy of the proposed committee rules was provided to your office together with a summary of the proposed changes to the rules from last Congress. The rules are very similar to the rules that have been in place in previous Congresses. However, the committee rules have been revised to include technical and conforming changes to meet House rules adopted this Congress, adjustments to the subcommittee ratios, and we were able to coordinate these changes with Ranking Member Graves and worked closely with his staff. I recognize Ranking Member Graves for a statement on the proposed rules.
Thank you, Mr. Chairman. I'm pleased to support the committee's rules package for the 117th Congress. The rules are relatively unchanged from last Congress, with only a few minor revisions to comply with the House rules for the 117th Congress, and I'd urge all of my colleagues to support the rules package and yield back.
Is there further discussion on the committee rules? If not, I recognize Ranking Member Graves for the motion. What? Yes.
Chairman, I have a question.
Yes.
I know we conformed ours to the House rules, and there was a change in the, I don't know what you'd call it, just the gender addressing of people. I noticed on our placards that mine says Mr. Webster, and it can't be that under the new rules. I'm just wondering if that's just maybe we're in between and we're getting new nameplates, or what's going on?
I thank the gentleman, and we'll have to take appropriate corrective action. I'm not certain what the proper format will be.
I don't know either. I think we recognize you as chair. I see you have chairman.
I thank the gentleman, and
So, Mr. Chairman, I don't think you can say gentleman. I'm just saying.
yeah. Well, I am a chairman, and we have chairwomen, so I'm a bit confused as to the prohibition on the word Mr. or Ms. or Mrs. So it seems that covers us, but I will consult with my legal counsel and attempt to delve to the bottom of this very important, extraordinary issue and change in the rules. I thank the gentleman for alerting me to the possible violation.
You're welcome.
We maybe just put tape over them. Black tape. I've got a bunch of black duct tape. Okay. Any more discussion? Good. Okay. Therefore, I recognize Mr. Graves for a motion.
Thank you, Mr. Chairman. I move that the rules of the Committee on Transportation and Infrastructure now before us be approved and adopted as the rules of the Committee for the 117th Congress.
Questions on the motion? Please unmute yourselves. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Anybody who is opposed, say nay. Opinion of the chair, the ayes have it. Motion's agreed to. There we go. Pursuant to House rules, the rules of the Committee on Transportation Infrastructure under 17th Congress will be printed and made available to all members of the committee and public on the committee's website. The clerk is also directed to have the rules printed in the congressional record. Now we move on to subcommittee chairs and ranking members. Now, the rosters for the full committee and each subcommittee listing of the chairs and ranking members are provided electronically to each of your offices. Subcommittee chairs are Rick Larson, Washington, Aviation, Coast Guard, Maritime Transportation, Salute Capital of California, Economic Development, Public Buildings, Emergency Management, Rep. Dina Titus, Nevada, Highways and Transit, Congresswoman Eleanor Holmes Norton, Washington, D.C., Railroads, Pipelines, Hazardous Materials, Rep. Donald Payne, New Jersey, Water Resources and Environment, Rep. Grace F. Napolitano, California. I recognize Mr. Graves to introduce the subcommittee ranking members.
Thank you, Mr. Chairman. This Congress, I'm excited to have many returning ranking members in addition to 2 new ranking members. First, let me start with our new additions. Representative David Rouser, North Carolina. He's been selected to serve as a ranking member of the Water Resources and Environment Committee. Representative Rouser served on the committee since coming to Congress in 2014. Since that time, he's been involved in the development of every Water Resources Development Act or WRDA bill, and I look forward to working with him as we develop a bipartisan WRDA bill this Congress. Also, Representative Daniel Webster of Florida will be serving as ranking member of the Subcommittee on Economic Development, Public Buildings, and Emergency Management. With the annual hurricane season the Florida faces, Representative Webster has significant experience with federal disaster preparation, mitigation, and recovery programs. He's also been involved in the development, passage, and implementation of programs and policies to spur economic development, both in his state and nationally. And his experience is going to provide some valuable insight as he helps to lead this subcommittee. We have 4 returning subcommittee ranking members, all of whom have made significant contributions to our work last Congress. Garrett Graves of Louisiana is going to serve as ranking member on Aviation. Bob Gibbs of Ohio is going to serve as ranking member of Coast Guard and Maritime Transportation. Rodney Davis of Illinois is going to serve as ranking member on Highways and Transit. Rick Crawford of Arkansas is going to serve as a ranking member of Railroads, Pipelines, and Hazardous Materials. I look forward to working with these strong group of leaders, and I'm excited for them to bring their perspectives to improve the issues of these subcommittees. And with that, I yield back.
Thank you, gentlemen. Any further discussion on the chair's ranking members of the subcommittees? If not, I recognize Mr. Graves for motion.
I move that subcommittee chairs and ranking members are set forth in the rosters that they be approved.
Okay, questions on the motion? Please unmute yourselves. All those in favor signify by saying aye.
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 All those opposed by saying nay. Ayes have it. Motion's agreed to. Congratulations to all our chairs and ranking members. I look forward to working with you all. And look forward to your getting right to work. And, we have a lot of committee work weeks this year. So I want to see that the committees are active in legislative and oversight matters in areas under their purview. Our final order of business is to approve the subcommittee assignments. A copy of each subcommittee roster has been provided electronically to your office. I recognize Mr. Gray's for a statement.
Thank you, Chairman DeFazio, and thank you for working with us to determine these the subcommittee ratios. Every member brings their own unique background and experience to each subcommittee, and it's going to be useful as we get to work on a lot of those important issues that we've talked about. I'd urge my colleagues to support the approval of subcommittee rosters, and I'd yield back.
I thank the gentleman. Any further discussion on the subcommittee assignments? If not, I recognize Mr. Graves for motion.
I move that subcommittee assignments as set forth in the roster be approved.
Questions on the motion? Please unmute yourselves. All those in favor signify by saying aye. Aye.
Aye.
All those opposed signify by saying nay. The ayes have it. Motion's agreed to. Pursuant to Rule 5 of the committee's rules of the Committee on Transportation Infrastructure, the chair notes the presence of a quorum for actions taken in all committee business today. With that, the Committee on Transportation Infrastructure has completed its organizational meeting. I now call the full committee hearing to order. I ask unanimous consent, the chair be authorized to declare recess any time during today's hearing without objection, so ordered. Today we are here to discuss one aspect of COVID-19 impact on the transportation system, its workers, its passengers, the gaps that still exist in protecting these workers and passengers, the lessons we've learned from the federal government's response to the pandemic so far, and potential next steps to better protect transportation workers and passengers from COVID-19 and other future potential health crises. It's hit a lot of sectors hard. The reduction in mass transit ridership, aviation has led to devastating economic consequences for local, state governments, transit agencies, and commercial airlines. Maritime and trucking have been hit variably depending upon their lines of business, but for all, there have been consequences in terms of COVID itself. The transportation workers have been very hard hit by health dangers and and also the financial repercussions of the COVID health crisis. Transportation Trades, which represents a lot of these transportation workers, is sharing some of those stories online as we speak. And I would encourage people to check out COVID transportation stories on Twitter to hear even more examples of why today's hearing is so important, but only after you've sat through the fascinating hearing. I'm thankful, however, that we now have a common sense national strategy unveiled by the Biden administration first day in office. It won't be easy. There's no immediate fix, but at least they have put in place some basic national consistent measures. We need more PPE, obviously. Maritime workers are moving cargo through our ports. Bus drivers, rail operators are helping doctors, nurses, American workers engaged in combating COVID-19 to their essential jobs. Aviation is transporting some of these same essential people and the vaccines by air. Transportation workers in all of these modes are at a high risk of contacting COVID-19. Close quarters, large number of individuals that travel, and frequent trips make them particularly vulnerable. Truck drivers, bus drivers, delivery personnel, mechanics, engineers, maritime workers, pilots, flight crews, railroad conductors have all been impacted by COVID-19 economically, socially, and medically. Many have been infected, and some, tragically, actually quite a few, have lost their lives. For months, I pushed for a national mandate for transportation workers and passengers, but unfortunately, the previous administration would not impose such a mandate. Flight attendants and bus drivers, when measures have been adopted by individual airlines as rules of the airline and or by transit agencies in local jurisdictions, flight attendants and bus drivers have been harassed, beaten, attacked while carrying out their job duties, trying to protect themselves and their other passengers from those who refuse to wear a face mask. We owe those workers a debt of gratitude for their commitment and courage for showing up every day to keep America moving. Now, those mandates will be backed by federal law. I have had conversations with Administrator Dixon. The maximum fine is $35,000 and 1 year imprisonment, and they will be for egregious cases pursuing those maximum fines to get the attention of people. CDC just came out with guidance, which we'll get into, on what constitutes a proper mask, which is going to be confusing and is going to require a lot of work by the various modes to get that information to their users, their passengers, their customers. So that's a work in progress as of this week. I've actually contacted, I talked to Chair Thompson of the Homeland Security Committee. We have a new memorandum of understanding with them on areas of mutual concern and interest, and I informed him that I'm going to contact the head of the Transportation Safety Administration and ask them to take the lead, at least in airports, on enforcing this mandate, because if people get past TSA and they get to the gate and none of the vendors down there sell masks, it becomes a big problem. You're supposed to actually have the mask on as you enter the airport, so by the time they get to TSA, they should have a proper mask on, and they should put up posters like they do for everything else we can't carry on about what kind of masks you can have and you can't. This is going to be a difficult transition. As Dr. David Michaels, the former head of Osha under the Obama administration, one of the witnesses here today has pointed out Trump administration steadfastly refused to put forward regulations to protect American workers and workforce at large. That has now the new, their OSHA is now developing individual workplace, because all workplaces vary, mandates and requirements. Some of the states have done it individually, but it's better to have a national system and a national plan. You got to wear a hard hat when you're on a construction site, even if it's a construction site where it's not likely anything's going to fall on your head. But not having mandatory requirements for something as dangerous as COVID-19 was a huge lack. Face masks, proper ventilation systems can help. We'll hear from ASHRAE today talking about that. I was interested in some of their assessment of different environments in terms of transmission, airborne transmission of the virus, and I'll look forward to their testimony and the testimony of others working directly with the traveling public. We need a massive increase in testing capacity. I have concerns that the CDC is considering a national mandate that everyone have a COVID test before they fly. That would mean an immediate increase of at least 50% in daily testing capacity, and I don't know where that comes from. And furthermore, I'm not certain of its effectiveness, given even the most effective test, is not particularly accurate. The PCR, it has a 100% failure rate at day one, and people are most infectious days -1, -2, and day +1. I just question whether this would be effective. And if it's necessary in aviation, well, then I guess we'd have to worry about interstate trucking, interstate buses, Amtrak, and people who get in their automobiles and cross state lines. So I hope we'll have some discussion of that here today also. With that, I'd recognize the ranking member for his opening remarks.
Thank you, Chairman DeFazio, and I appreciate our witnesses being here today to testify about the impact of the COVID pandemic and what impact it's having on transportation workers and how we can continue forward through a safe recovery. The pandemic has ravaged our country since the first case was reported in January 2020. Many workers can't work virtually like we are today and continue to show up in person to perform those essential services that we all rely upon. Notably, this includes our frontline transportation workers that make sure our grocery store shelves are stocked, that safely transport people across the country and ensure that our frontline workers can get to their jobs to help serve the public. Just like the overall economy, different sectors of the transportation economy have been affected or been impacted in different ways by the coronavirus. And since the last time that we examined this topic, Congress has authorized an unprecedented amount of $113 billion to support different sectors of the transportation industry to ensure that workers stay employed and that these businesses can bounce back quickly. This assistance includes grants totaling $60 billion for airlines, airports, and their contractors, $39 billion for transit systems, $10 billion for state departments of transportation, $2 billion for Amtrak, and $2 billion for motor coach operators, school bus companies, and passenger ferries. We need to ensure that all of this money leaves the federal government and gets to the intended recipients as soon as possible. Moving forward through the recovery, we must make safe, smart, and responsible decisions to get our workforce going and begin hiring again. This is going to affect our ability to restart and reconnect supply chains that are key to the economic recovery. As Americans get back to traveling, they need safe and effective measures to give them the confidence that they need to return. But we also have to ensure that the workers providing these transportation services are safe as well. I'm glad we have the opportunity today to hear directly from frontline workers about their experiences during the pandemic. Thank you again for participating today, but more importantly, thank you for keeping the country, our country moving in these very difficult times. Thank you very much, and with that, I yield back, Mr. Chairman.
Thank the ranking member. I'd now like to welcome witnesses on our panel. Professor David Michaels, Department of Environmental and Occupational Health, Milken Institute School of Public Health, George Washington University. Ms. Sarah Nelson, International President, Association of Flight Attendants, CWA. Mr. Louis Pugh, Executive Vice President, Owner Operator Independent Drivers Association. Mr. Ishmael Rivera, a bus operator from Four Links and member of ATU, Amalgamated Transportation Union Local 1596, Orlando. Professor William Bonfleth, a professor of architectural engineering for Pennsylvania State University, chair of the ASHRAE Epidemic Task Force, and the Honorable Joe Buscano, Councilman, Los Angeles City Council, past president, National League of Cities. On behalf of National League of Cities, thanks for joining us today. Look forward to your testimony. Without objection, our witnesses' full statements will be included in the record and have been distributed previous to this meeting. And many of us have read your written testimony. So I would urge that you may deviate, you may expand, expound, you may respond to others who are on the panel if you come after them. I'd like to have something a little more active than sitting there reading my notes. With that, you will each be recognized for 5 minutes. Professor Michaels, you may proceed.
Thank you, Chairman DeFazio, Ranking Member Graves, distinguished members of this panel. My name is David Michaels. I'm an epidemiologist and professor at the George Washington University School of Public Health. From 2009 to 2017, I served as Assistant Secretary of Labor for the Occupational Safety and Health Administration, the longest serving administrator in OSHA's history. From 1998 to 2001, I was Assistant Secretary for Environment, Safety, and Health at the U.S. Department of Energy, protecting the workers, the communities, and the environment around the nation's nuclear weapons facilities. Since this pandemic began, much of my work has focused on improving the protection of workers exposed to the virus that causes COVID-19. I was a member of the Biden-Harris COVID-19 Advisory Board and served on the National Academy's expert panel that developed the framework for equitable vaccine allocation. COVID-19 has created an unprecedented public health crisis with a huge impact on the transportation sector. Workers need better protection to avoid illness and death. Passengers need reassurance they can travel without fear of infection. And the industry needs safe workers and willing passengers to survive in this difficult period. We don't know how many workers have developed or died from COVID after workplace exposures, but there are many studies demonstrating that exposure in transportation greatly increases risk of disease. We have to protect transportation workers and passengers from COVID, and we know how to do it. Every transportation system must develop a plan to prevent virus exposure. Look, infection control is not simple or easy, and it requires the active cooperation of everyone involved. Plans must be developed, implemented, and evaluated collaboratively with the workers, and if there is one, the workers' union. This infection control plan must be based on what we call the hierarchy of controls. This is a widely applied set of principles to prevent workplace health hazards. It's the basis for modern industrial hygiene and for all of OSHA's health standards. The most effective way to reduce exposure is to make sure that people who may be spreading the virus stay home. Workers need to be supported financially to enable them to quarantine or to isolate, and small employers may need help paying for this. Enacting emergency sick leave support should be a very high legislative priority. Masking is the next step in keeping the virus out of the air of the workplace. The CDC now requires all passengers and workers on global and intrastate transportation to be masked. This will no doubt save many lives. But once the virus gets into the air, individuals must be kept far apart. 6 feet apart is the often cited requirement, but this is an arbitrary distance, and more is always better. And even 6 feet is impossible in many transportation settings, underscoring the need for mandatory masks, maximizing ventilation, and ensuring appropriate filtration. In many cases, ventilation and filtration on buses and other modes of public transportation will need to be improved. OSHA, the federal agency charged with ensuring worker safety and health, has just strengthened its COVID safety recommendations, and as you heard, is likely to soon finally issue an emergency standard, including requirements for masks, distance, and ventilation, as well as, very importantly, protection against retaliation for workers who raise safety concerns. Effective enforcement of public health rules will require active collaboration between Transportation Security Administration, DOT agencies, OSHA, and transportation employers and unions. However, many of the transportation workers at highest risk for COVID are not covered by OSHA. DOT agencies with weak or no worker protections have preempted OSHA's authority. The result is that for large numbers of transportation employees, their workplaces are OSHA-free zones. This committee should strongly encourage DOT agencies to quickly develop joint regulatory and enforcement efforts with OSHA. Prioritizing vaccination of transportation workers at high risk is also of great importance. The federal government should establish a vaccination program specifically for workers involved in interstate or global travel on land, air, and sea, and provide the vaccines at hubs and ports they pass through for their work. So in summary, the federal government must take strong actions to ensure the safety of passengers who rely on transportation systems, their workers, and the communities in which passengers and workers live. If transportation is not safe, we will not be able to stem this pandemic and return the economy to normalcy. Thank you very much.
Dr. Michaels, we would now proceed to Ms. Sarah Nelson, Association of Flight Attendants President.
Thank you, Chairman DeFazio and Ranking Member Graves and the members of the committee for the opportunity to testify today. Together, we're tackling the worst public health crisis in over 100 years and a financial crisis deeper than all previous economic disruptors combined our industry has faced in its 100-year history. In the absence of a federal plan until recent days with the Biden administration, I want to recognize the airline industry for working with unions on safety measures such as required mask policies for airports and airplanes. Receiving backing from the federal government on these mask requirements makes all the difference for flight attendants, passenger service agents, and TSA officers who are tasked with ensuring travelers comply. It has been difficult and combative at times without clear instruction to the public. We applaud FAA Administrator Steve Dixon for his strong statements and emergency order to make clear there will be no second chances for passengers who fail to comply with crew member instructions that keep everyone safe. Violators will face the federal penalties of up to $35,000 and imprisonment. This zero tolerance policy is in effect through the end of March, and we encourage the FAA to extend it. Aviation is critical for vaccine distribution, and the people on the front lines of aviation need priority. We encourage the federal government to set up vaccine clinics at major airports and make it easy for airline crew members to access both their first and second doses. This will maximize efficacy of the vaccine and prevent wasted doses. Until we can contain the virus and fully open our economy, the airline industry will continue to operate at massive losses. The good news is that with the support of this committee and Chairman DeFazio leading the way, we created the first federal relief program that is truly workers first, which covered 2.1 million workers under the CARES Act through September 30th of 2020. When it was not extended, furloughs, separations, and no paid status began on October 1st, affecting hundreds of thousands of workers and those still working. The late December emergency relief continued the same requirements of the original CARES Act PSP. No furloughs or layoffs and reinstatement of pay as of December 1st through March 31st. No cuts to hourly wage rates. Maintain and restore service to all communities. Caps on executive compensation for 2 years beyond the relief period, and a ban on stock buybacks and dividends. This Workers First plan we hoped would be a template for relief across other industries. It looks much like the successful programs we've seen in Europe, except that in this country, it's even more valuable because healthcare is also tied to employment. We need to extend the PSP through September 30th of 2021 with a $15 billion in payroll support program, and we thank this committee for promoting this as part of the COVID relief package Congress is working to secure for Americans in the coming weeks. The program is the best use of the public's money because it uses the payroll systems that airlines and contractors already in place. Workers continue to pay taxes, supporting their cities and states' tax base, continued Social Security contributions, Medicare, and more. Healthcare, pension and retirement contributions, sick leave programs, and other protections remain in place. When the program lapsed, furloughs caused certification and security credentials to lapse too. Nearly 3 months of furloughs caused a 4-month recovery of the credentials to get everyone back to work. Without an extension, this problem will grow exponentially. Airline workers are getting back in place to support vaccine distribution and recovery. We support 1 in 14 jobs in this country. PSP supports the best public health decisions, no cost-cutting strains on safety and health policies. In the long term, airline balance sheets are already loaded up on debt. Debt-heavy balance sheets will lag recovery and create downward pressure on good jobs and hurt consumers too. There were endless arguments about why PSP makes sense on a government balance sheet, but this is really about the people. The flight attendant who sought this union job because she had Crohn's disease and needed regular preventive care in order to live a normal life, but who without it becomes so ill she can't even look for another job. The flight attendant who cares for elderly parents and whose sister and husband lost their jobs during COVID, but have children to provide for. And so the entire family moved in together and he became the sole provider thanks to PSP. The flight attendant who was forced to work more during the furloughs because in a cost-cutting environment, productivity is driven high. She was displaced from her home base and sent to spend more time on an airplane to get to work out of Philadelphia instead of Phoenix. She lost her life due to COVID just this past week. Furloughs disproportionately affect women and people of color and force an older workforce to leave home more often to work with greater risks of serious effects of the virus. Aviation has a long history of collaboration among government, industry, unions, scientists, and consumers. We can beat COVID and emerge stronger. And let's do this together. I look forward to your questions. Thank you.
I thank the gentlelady. I would now move on to Mr. Pugh. Mr. Pugh, you have 5 minutes. Unmute wherever you are.
Thank you very much. I appreciate it. And I'm Louis Pugh with the Owner-Operator Independent Drivers Association. Prior to working here, I have over 23 years experience of driving and being a small business trucking owner. Still have a CDL, thank you. Throughout the COVID-19 pandemic, small business truckers and professional drivers literally put their lives on the line. When many of the Americans began working from home, truckers continued to crisscross this nation, picking up and delivering the items that we all needed. When COVID first hit, shippers and receivers started restricting access. Suddenly, finding a place to use the restroom became very difficult, even impossible at times. Drivers weren't able to find masks, hand sanitizer, or even bottled water. Ironically, they were delivering everything Americans needed to survive, yet they could hardly buy much of this themselves. And it wasn't until FEMA began distributing these items in truck stops that truckers finally were able to get what they needed. They also had no real idea what they were to do if they experienced COVID symptoms themselves, a lot of times hundreds, if not thousands of miles from home. And then things went from horrible to unimaginable when freight rates dropped to historic lows. Some loads were paying pennies per mile. By May of 2020, roughly 80,000 truckers were out of work. Congress, you could have temporarily suspended the federal diesel tax so drivers could have kept some extra money in their pockets during these toughest times. You could have waived the heavy vehicle use tax so the truck owners would have got a modest break. You could have reinstated the per diem for employee drivers or even suspended UCR payments. Instead, you hung your hats on PPP, which failed most small carriers. DOT and DHS, they did rise to the occasion. They were engaged with the industry and took a number of steps to address the real issues that were affecting drivers. For example, the Federal Highway Administration permitted states to allow food trucks in rest areas. Unfortunately, many states, just like here in Missouri, wouldn't allow truckers or wouldn't allow the food trucks in these rest areas. Think about that. Truckers couldn't buy food in a truck stop, they couldn't buy food in a restaurant, and yet states had the nerve to deny them to even have a hot meal at a rest area. We here at OIDA were not even allowed to give away free food in a rest area. To me, that's a real shame. We were all shocked last year when this committee voted in the middle of a global catastrophe to increase federal insurance requirements by $1.25 million. Truckers watched in disbelief as this panel, who was patting them on the back on social media, went to kicking them while they were down. Things are getting better, but safe truck parking is still at a national crisis. Last year, this committee provided $250 million for truck parking projects in the highway bill. That's a great starting point, but more must be done. Thank you to Representative Mike Bost and Angie Craig for working with us to develop a bill to address the problem. Despite there being over 65 members on this committee in the last Congress, only 4 of you co-sponsored this legislation. So what do we want? We want more truck parking. Not only should you co-sponsor the Truck Parking Safety Improvement Act, but let's get it done. Try to do something good for truckers without doing something bad. Don't cripple them with unnecessary insurance increases and speed limiter mandate. Repeal the overtime exemption for employee drivers. I've been asked by legislators what would be a result of this. The result would be truckers would finally be paid for the time that they work. This would also cure the driver churn that big carriers told as a shortage. Reinstate the per diem for employee drivers. Let them deduct their meals while they're out on the road again. You can take steps to help, but you must avoid causing unnecessary damage. Truckers have earned your respect by now. Show them some real appreciation. Twitter statements are real nice, but they don't put food on the table. Drivers still worry about how they're going to get the vaccine while they continue to work. Finding a decent meal is still tough for them. Many are concerned about the future of their business, uncertain freight markets, and new regulations. Some even fear that their business will survive COVID only to be put out of business by you, Congress. So I appreciate this time and look forward to answering your questions. Thank you.
Thank you, Mr. Pugh. Mr. Rivera.
Good afternoon. Hello, and thank you for the opportunity to testify. My name is Ishmael Rivera. I've been a transit worker since 1997. I began driving a bus for New York City Transit Authority and came to Lynx in Orlando 17 years ago, where I am a proud member of ATU Local 1596. Led by International John Costa, ATU has taken extraordinary steps since the beginning of this pandemic to keep transit workers and passengers safe and save our members' jobs. ATU developed a list of demands for the transit systems on the safe provisions of service, including gloves, masks, protective barriers, pandemic leave, rear door entry, and on-site testing. The International also partnered with transit agencies to secure $39 billion in federal funding to save the industry and buy PPE, and we are now seeking another $39.3 billion. Our union in many locations stepped up and helped the transit systems acquire gloves and masks. ATU International also launched a mass education campaign to ensure our members know their right to refuse to work when confronted with hazardous safety conditions. Driving the bus has always been a tough job. Bus drivers get attacked on moving vehicles regularly. Now we are being attacked by an invisible enemy. Each time a passenger coughs just a few feet behind us, we know that we are in a potential death trap, driving down the road in a tin can with bad air circulation. 126 ATU members have died due to COVID, and thousands have been infected. In addition to driving a bus, ATU members also now serve as the mass police. We are getting brutally attacked for simply enforcing the rules and trying to stop the spread of the virus. There was a baseball bat beating in California and a 2x4 attack in Texas. Here in Florida, a homeless woman boarded a bus and began coughing on passengers. The driver told her she needed to wear a mask. The woman then spat on the driver. When someone boards without a mask, we are faced with a tough choice. Say nothing and risk that an infected rider will spread the virus, or tell them to put on a mask and risk a violent reaction. It's just the beginning. I am constantly checking the mirror, making sure that riders are keeping their masks on. They often pull the mask off, and that's when the real tension begins. I'm a bus driver, not a police officer. I don't need political debates on my bus, but that's the way things are right now. Social distancing on a bus is very hard to do. In Orlando, we have been told to limit our capacity to 15 passengers on a 40-foot bus. Although the agency gives us discretion to allow a few more riders, passengers are allowed in front rows, which is too close for comfort for many of us. Lynx gives us 4 masks per shift for passengers, who don't have one, and we hit the road hoping that's enough. We come in early to wipe down the vehicles, especially the driver shields. Our shields are better than nothing, but still leave a gap exposing us to attacks. We must still touch wheelchairs to help disabled riders get on board, secure their wheelchairs, and help them exit. The buses we drive have major issues with airflow, sterilization, and filters. It's no wonder so many of us are dying. By my count, about 20 workers at Lynx have been infected with coronavirus, including myself. We do have contact tracing for what it's worth. Florida officials are not following federal vaccine guidelines, giving transit workers priority. So despite our high risk, we wait for the shot, putting our lives on the line every day. FTA needs to fully use its safety authority as soon as possible. President Biden's action on day one requiring masks on public transit is a great start. We need high quality masks available more widely and help enforcing mask requirements and making sure buses are not overcrowded. ATU joins APTA, urging Congress to provide an additional $39.3 billion in relief to help systems running and buy PPE. We strongly support hazard pay for transit workers in the next COVID bill. Our members are heroes, but we get treated like zeros at the bargaining table. It's not right. Finally, the CARES Act required employers have to offer 2 weeks of paid sick leave to anyone who got sick with COVID or had to quarantine because they've been exposed. That expired in 2020. Congress needs to restore this. Nowadays, getting behind the wheel of a bus or working in the maintenance shop when you are not feeling well can have deadly consequences for so many people. In conclusion, COVID has shown the world the true meaning of essential workers. Since the pandemic began, transit workers have put their lives on the line, bravely reporting to work every day. With continued operations funding, common sense, safety measures, and a seat at the table for the workers to express their concerns, we can work our way through these challenges together. Thank you very much.
Thank you. We now move to Professor Bonfleth.
Thank you, Chairman DeFazio and Ranking Member Graves, for the opportunity to address the committee today. I'm testifying on behalf of ASHRAE, a professional and technical society of more than 55,000 individual members dedicated to advancing the arts and sciences of heating, refrigerating, air conditioning, and allied fields. The president of ASHRAE, Charles Gullidge, extends his thanks for your investigation of this important subject and offers ASHRAE's continued technical support. I chair the ASHRAE Epidemic Task Force, which was formed to develop the guidance for space conditioning systems needed to make indoor environments as safe as possible during the pandemic. Task Force members are volunteer experts who specialize in making indoor environments safer and healthier. ASHRAE guidance, standards, and other resources are science-based and free from commercial interests. The task force has produced hundreds of pages of widely referenced guidance materials based on current understanding of infection transmission and control, including recommendations specific to transportation systems. COVID-19 is believed to transmit by 3 modes. Short-range droplet transmission that occurs when an infected person and a susceptible one are close together. Public health authorities have long held that this is the most important mode. Fomite transmission that occurs when an infected person contaminates an intermediate object that's then touched by a susceptible person who infects themselves. There's little evidence that this is a common mode of transmission. Airborne transmission resulting from the inhalation of fine particles small enough to remain airborne for long periods of time that can move far from their source is the other mode. The perceived importance of airborne transmission has grown substantially over the course of the pandemic. Each mode has specific controls: distancing and masks for short-range transmission, cleaning and personal hygiene for fomite transmission, and HVAC engineering controls for airborne transmission, ventilation, air distribution, filtration, and air cleaners. Masks also help control airborne transmission by reducing aerosol emissions from infected persons. How do these fundamentals apply to the protection of transportation workers and passengers? First, public health guidance should be followed. Distancing, hygiene, and indoor mask use are critically important. Secondly, mobile environments, aircraft, ships, cars, buses, and trains, are indoor environments provided with some level of HVAC system. The same engineering controls applied to buildings also apply generally to mobile environments. With respect to engineering controls, ASHRAE's primary recommendations are: provide at least required full occupancy ventilation whenever people are present, including janitorial and maintenance crews. use filters for recirculated air that remove infectious particles efficiently. If necessary, supplement ventilation and filtration with air cleaners demonstrated to be effective and safe. Combine ventilation, filtration, and air cleaners to meet risk reduction targets while minimizing energy use and costs. Avoid indoor airflows that can extend short-range transmission by large droplets. Prevent reentry of contaminated air. And finally, commission systems to verify that they are functioning as designed. This can improve protection and reduce energy use. Transportation HVAC systems vary widely in terms of the levels of ventilation and filtration they provide, as others have already noted. Aircraft have highly maintained systems that provide large air change rates and utilize high efficiency filters. The age, condition, and air quality controls of buses and trains, however, cover a wide range and may present significant risk to passengers and workers alike. Ships may have good HVAC systems, but space layouts that make distancing difficult. Thus, it is hard to generalize, but what is generally true is that there is non-negligible potential for COVID-19 transmission on all modes of transport. Published studies of COVID-19 outbreaks document, among others, a 10-hour flight carrying 217 travelers that resulted in 14 infections, a 7.5-hour flight only 17% full that yielded 13 cases among 49 passengers.
Tell me when you get there.
A 100-minute trip in a poorly ventilated bus on which 24 of 68 passengers were infected by a single person, and an ocean cruise on which 712 of 3,711 passengers and crew members contracted COVID-19. For the safety of those who must travel and those whose work is supporting travel, the ventilation and filtration capabilities of mobile environments, as well as related stationary facilities, should be evaluated and updated as necessary. Post-pandemic, consideration of significant design changes for new systems may be warranted. Some technologies needed to make future transportation safer are available now, but there are also many opportunities and needs for applied research to improve system design. ASHRAE is committed to support this effort, helping to ensure that the safest possible conditions are provided for all who need and want to travel today and in the future. I appreciate the committee's attention. I will be happy to answer your questions. Thank you.
Thank you, Professor. Now, Councilman Buscano.
Good morning, Chair DeFazio, Ranking Member Graves, and members of the committee. I am here today on behalf of the National League of Cities, the nation's oldest and largest network of cities, towns, and villages across America. The nation's cities are on the front lines of the COVID-19 response, and it's clear that the health and economic crisis is not over. Together, Congress and America's city communities must keep up the pace this year to respond, recover, and rebuild from the COVID-19 pandemic and the economic challenges that came with such a prolonged and devastating pandemic. Local governments and our essential employees have been organizing since the first cases of COVID-19 were reported. Whether it was mask-wearing policies, keeping essential workers and projects moving, or supporting local restaurants and businesses with sidewalk or street access, we have tried to tackle every challenge head-on. Locals are working to keep essential services and workers moving during COVID-19, but it's created a ripple effect of shutdowns and devastating health impacts that has docked almost every budget line in our city. This year, local budgets nationally are facing a shortfall of at least $90 billion, and we've depleted our reserves throughout 2020 on COVID expenses, leaving little cushion. To balance budgets, it's cost the U.S. 1.3 million good government jobs, including transportation workers. In Los Angeles alone, the city's budget is short by $600 million this year, which will wipe out our $259 million reserve savings. It also leaves us with an unpaid $75 million loan to ourselves from our Public Works Trust Fund, which must be repaid on July 1st per our city charter. Large cities like ours that were lucky enough to get CARES Act COVID relief funding have met needs quickly. 96% of LA's CARES relief funding have been used, while many cities and towns had to wait for state or county allocation. They put their CRF funds to good use by getting PPE to essential city workers, helping small businesses, and providing housing relief to families. I want you to know, colleagues, that any relief Congress passes for cities will be used to continue to support our most valuable asset, our people. America's communities are proud to have a dedicated and resilient workforce of professional essential workers who have kept everything running, especially those who are part of our national supply chain, like my family and friends and neighbors in my hometown community of San Pedro that work the docks at the Port of Los Angeles, and those that provide transportation to our communities. Unfortunately, far too many have fallen ill and or lost their lives, like my dear friend Eddie Greenwood. They protect others from the virus. Our dock workers may be essential, but shouldn't be sacrificial. We salute them as essential workers, and this committee can honor their sacrifices by taking steps to protect them and their jobs. Most importantly, colleagues, we have to get essential supplies to and vaccinations to essential workers. The COVID-19 spread to dock workers at the Port of Los Angeles is concerning, and we've come close to having to shut down. 10% of our longshore work are quarantined, while more than 30 ships are lined up waiting to unload all the goods Americans are ordering online and getting shipped to their doorstep. This is unheard of at our port complex. Port truck drivers, the men and women who haul containers from our nation's seaports to warehouses, distribution centers, and rail yards are also essential workers, transporting necessities like food and medical supplies, like PPE, to make sure that we all can survive this pandemic. But because they are misclassified as independent contractors, they don't receive sick leave and are not offered any protections to guard against the virus. This situation leaves drivers to fend for themselves against the pandemic, placing their lives at risk and threatening our supply chain that provides over 40% of goods to the country. It's clear and stronger connection is needed between FEMA declarations during a pandemic, DHS definitions of essential workers, and then access to PPE for our essential workers. We cannot have a Wild West PPE procurement strategy from profiteering to seizures. It was a mess, and it cost us more. We must do better. Finally, the federal government can directly partner with local governments to support workers effectively. The National League of Cities recommends passing additional COVID relief using formula like the one in HR 199 by Representatives Delgado, Katko, and Zeldin, and keeping our transit moving. FEMA can be a more reliable partner, and we thank President Biden and FEMA for ensuring that COVID relief will be 100% federally matched. We ask this committee to support our transportation workers across all modes by working with us and to help us bridge the last gap between now and substantial vaccine distribution. Members, colleagues, we must act with urgency. And we must all be prepared to tackle the important rebuilding that's ahead of us. Mr. Chairman, thank you, sir.
Thanks, gentlemen, for his testimony. We'll now move on to member questions. Each member will be recognized for 5 minutes. I'll start by recognizing myself. Sorry. I ask unanimous consent to insert the hearing record letter from the National Safety Council without objection. So ordered. Thank you. All right. Okay, I'm going to move to, since this is potentially looming, the issue of mandatory COVID testing before people get on airplanes, what that would do potentially to the industry, what it would mean for diverting COVID tests from other needed places, et cetera. So I'd first start with Ms. Nelson.
Thank you, Chairman DeFazio. Let's just recognize that this would be devastating to the airline industry. We cannot do cosmetic things that won't actually contain, kill the virus, and make sure that we are eradicating it. We do not have the test to be able to perform this. Isolating the airline industry and not doing the same thing for mass transit or doing this at grocery stores or restaurants doesn't make any sense as we have community spread. So this would really be more about targeting the airline industry and the workers who would suffer from this policy without having something that we can actually do that's effective. We really need to focus our efforts on effective methods of containing the virus and keeping us all safe.
Okay, thank you. Would one of our two healthcare experts like to comment on the problems and/or potential for such a measure?
Certainly, Mr. Chairman. I agree with Sarah Nelson. I think while testing can be useful, I actually don't think it adds much. I think we know how to protect workers and passengers on planes. Masking, improved ventilation and filtration, and distancing has been shown to be very effective. And I think if you give people tests, given the possibility of false negatives, you actually could provide a sort of false security that we don't really want to have. So given the cost and the imposition of it, I would oppose that as well.
You raised the issue of distancing. If I could just get into that, I understand some analysis I've read said it's not so much the actual physical distance, because you can't get that far away from anybody in a plane, but the fact that you're limiting in total the capacity of the plane, which lessens the likelihood of a severely infected person transmitting on the plane. Is that your understanding of how we would deal with this in aviation? Because I'm only aware of one airline that has totally continued that policy at this point.
You know, I think it's a combination of factors. I think you certainly, you want to limit distance. The improved ventilation system will help you more than probably anything else. But my understanding is that airflow is key, and you've got to watch exactly where the air goes and test that. But you also want to limit the people who are sitting right next to each other, because people don't have their masks on all the time. They take masks off for eating and for other reasons. And that should happen in a minimal way, but it still does happen. So I think we've got to really focus on this from a public health point of view, get everybody together and say, okay, what's the way to ensure that, you know, these planes can be as safe as possible?
So since planes have the capability of more or less when in flight, it does cut into fuel mileage. If they run the packs on full, they should be running the packs on full at all times.
You know, I don't know much about fuel economy and fuel usage in airplanes. I'm going to pass on commenting on that.
Well, what I'm saying is we know we can get more air circulation, but they're going to burn a little more fuel. I think the trade-off would be beneficial. Okay.
That is unfortunately the case. You know, look, with COVID-19, everybody's got to make sacrifices. We've got to make sure people are safe.
Okay. And then Mr. Rivera, you talked about the problems. I mean, I can see enforcement and how we're going to do enforcement at the airport and on the airplanes, but how are we going to do enforcement and give you folks some help on the buses when you're all just so dispersed?
Well, on the bus sides, we would have to get more kind of PPE, better PPE, and get some kind of enforcement, law enforcement, get all the resources to help us on the ground. That's all I could say at the moment.
Okay. All right. Thank you. My time has expired.
Thank you.
I would now recognize first on the Republican side the Honorable Rodney Davis.
Mr. Chair, did you miss me? See, he didn't even say yes.
He said no. I have my microphone on.
You know, Mr. Chairman, I did miss you, and I missed all of our colleagues. And I'm wondering if there's a camera above me or there might be a bug, but you took my question on the CDC testing. But it's an excellent question, and I agree with you. It's something that needs to be addressed. And Sarah, you had great comments. I was going to ask you to offer the same comments as Chairman DeFazio did, and I think your answer and the other responses were spot on. This is an issue that can punish this industry and stop it at its most critical time from being able to overcome what we've all gone through, and especially the aviation industry over the last year. All of us, most of us in this room, utilize your industry, and we see the devastating effects that have taken place with a lack of passengers and a lack of ability to continue to operate in a very high-cost environment. And I want to thank you and your members, too, for the hard work they've done to keep passengers safe and also keep our aviation industry going. I do have a second question, and again, agree wholeheartedly with what the chairman said about this discussion of mandatory CDC testing, and agree wholeheartedly with you also, Sarah. But there's another issue I know that the chair and the ranking member and those of us on this committee have been working on, and that's trying to figure out the, and you mentioned in your testimony, the need for additional PSP dollars. How bad will it get for the aviation industry if both the PSP is not extended and the CDC implements a testing mandate?
Well, let's be clear. The furloughs that we saw in October would be dwarfed by the furloughs that we would see if we had a testing mandate that we can't effectively run. We would see many, many more furloughs, and without the extension of PSP, which also requires the airlines not to furlough and continue to support that payroll that they simply can't support in this kind of environment where revenue is down 80%. It would be devastating. And in that situation, we wouldn't just be talking about lost jobs, we'd also likely be talking about airline bankruptcies. So that is how devastating it would be. I just want to note one thing. The air travel, through the work of airlines working with unions, there's more we can do still, but it is one of the most controlled environments in the country for public health. And we need to focus on those controlled environments, focus on the mask policies, using those properly, single touch on service, no alcohol being served, which makes people take those masks off, and all the other things that we have been doing in layers of safety to keep this a controlled environment. Those are the things that we need to focus on with the continued payroll support to make this work and be able to lift the economy again. And just one other note, the airline industry employees are part of the infrastructure that this country counts on. And when we lose our jobs, we lose our qualifications. And it takes a long time for the airlines to get back up and running again and have the airlines in place to be able to support vaccine distribution and everything else that our communities count on, and then be able to lift the economy again. So it would be devastating not only for us, but for the whole country if PSP is not continued.
Well, I appreciate your comments, Sarah, and it's great to see you, even if it's via video. I think the last time we saw each other, we were at a bipartisan press conference talking about the importance of PSP last fall, and thankfully we came together in a bipartisan way to get those dollars to an industry that needed it. And it's great to see you teaming with the aviation industry and your members, employers, to be able to work together on solutions. That's what we need to do here, and I appreciate your voice and the chairman's voice and the ranking member's voice and all our voices in urging President Biden to include an additional round of PSP funding in any coronavirus package that's going to be debated via reconciliation or hopefully via a bipartisan agreement. So, Sarah, it's great to see you again. Thank you all for your testimony. Mr. Chairman, great to see you, my friend. I missed you, and I'll yield back.
Thanks, Rodney.
Thank you, Congressman.
I do have a few decent beers upstairs in the chairman's office. We'll get caught up sometime. The sun isn't, well, it is over the yardarm, but we're not. Anyway, Representative Eleanor Holmes Norton, you're recognized for.
Thank you. Thank you, Mr. Chairman, and I very much appreciate this hearing. It has the issues discussed here, transportation issues, have disproportionate effects in our nation's capital, which I represent. Ms. Nelson of the flight attendants, your testimony was very moving. And of course, your members are put in a disproportionate position. So let me ask you this question. Suppose one of your members sees a passenger not following the public health guidelines, like like wearing a mask. Can you kind of walk us through how your members respond? How are they trained to handle this difficult situation? And what are the potential repercussions they weigh when determining how to intervene? I'm just trying to find ways Congress can be helpful to you.
Thank you, Congresswoman Norton. Appreciate that very much. And we are trained in de-escalation tactics. We are trained in how to make sure that people are complying with the rules, because there's rules in aviation, and there has to be this spirit of we're all in it together to do things that are maybe a little bit uncomfortable so that we can all safely fly. Now, today, that absolutely includes the mask requirement. And so on the front end, making it clear to people with notifications from the airlines that they will absolutely acknowledge that they will wear that mask, they will wear it the right way. Announcements from the airlines to help people understand you've got to wear that over your nose and mouth. You've got to, if you're going to take a sip, make sure that the crews are a few rows away from you.
Miss Nelson, have you encountered people who simply refuse to wear masks? I'm trying to find out what position that puts a flight attendant in.
Yes, so we have, and it's one thing to say that someone's not used to doing this and reminding them, but the problems that we encounter are when people come to the door of the airplane or come into the airport and they have been told that this is a political issue rather than a public health issue, and they're confrontational. We have websites out there that instruct people about how to avoid wearing the mask the whole time. Just this past week, we had a family of 4 sucking on lollipops the whole time and thinking that that was going to be their excuse for not wearing the masks. Those people are being banned from that aircraft now. But we are trained in de-escalation and helping to advise people. So we know, flight attendants know, when we approach someone who maybe just forgot to put that mask back on and we're reminding them, as opposed to someone who is absolutely refusing to do that. And the refusal can either be trying to avoid it and coming up with sneaky ways to do that, or it can be outright confrontational, where we have had flight attendants even assaulted. This has been confrontations on the plane over the past year that have been very difficult for our members, and we are very grateful now for the FAA, with the backing of the Biden administration, stepping up and making it very clear there's going to be clear fines for anyone who is not complying.
Well, I wish you would keep us in touch with whether those fines are working, because the testimony was important for us to hear. Mr. Rivera, I'm particularly interested in what's happening with respect to our bus drivers and those in your union. You mentioned a series of CDC recommendations for transit systems that had been watered down by the prior administration. And in particular, I'm interested in what you had, I'm interested in the areas of airflow and the sterilization and filters that bus drivers may be concerned about. We know now that COVID is spread through the air as we learn more and more about it. Indeed, we're hearing the notion that people should be double masks, which scares me. What steps would you like to see taken for bus drivers who face this airflow issue as they let people on the bus, and filters that may be of concern to bus drivers?
Mr. Rivera, you have to be very
question.
brief because your time has expired, but answer quickly.
Okay, they need better ventilation because everything that goes on in the buses, the bus operator gets it at front. And we're constantly getting all the customers boarding the buses, and they're trying to have conversation and ask us questions without the masks. So they need better sterilizing the bus. The air filters have to be much better, and the flow itself has to be, they have to do a greater job than they're doing now.
Okay,
Thank you very much.
Thank you.
Thank you.
I now recognize Representative Webster for 5 minutes.
Thank you, Mr.
Chair.
Chairman. Did you say Webster or Webster?
I'd like to direct my questions to Dr. Bonfla. And thank you that ASHRAE has brought up air quality and the idea of using mechanical means to clear the air as opposed to inoculate somebody from getting the disease. This keeps the disease from getting to them, and I'm grateful for that. A couple of those recommendations in here I actually gave to the engineer of the Capitol over a year ago. And one was just increasing the fresh air. The other, though, is I have one of these. I don't know if you can see it or not. It's a ionizer. It produces about 2 million ions a second and basically takes down viruses and germs and so forth down to the ground and attaches themselves to them and takes them down. And my question is, I noticed that you had recommended UV lights, which is a great thing, and then also there are these ionizers. Do you know, have you done any tests on them? Not this particular one, but I'm talking about ones that would be fitted in duct systems and so forth. Have you done any tests on those also?
Thank you for the question. The short answer is no, I have not, but there is some literature on ionizers and also a lot of laboratory reports produced by the manufacturers. And the reason that ASHRAE and in fact CDC as well does not make an affirmative statement about ionizers is because the evidence base for them is simply not as strong as for UV. UV has been in use since the 1930s. It's approved by CDC for tuberculosis control. We don't have the same basis in peer-reviewed evidence for ionizers, either for effectiveness or safety, that we do for UV. But that said, there's some evidence that indicates it can be effective. On the other hand, some evidence that indicates that there may be some hazards associated with it. So I think one of our clear needs is to do the research to determine what the characteristics of that technology actually are and develop standards so that we can have certified products that we can apply confidently.
Maybe I'm frying my brain, I don't know. But the other question is, though, UV lights work, but you can't hang them around your neck. Basically, they'll blind you or they'll burn your skin. But I've heard, and maybe you could say something about this, because I don't know enough about it, but isn't there some studies or development of UV lights at maybe a shorter wavelength than I think the usual ones are about 254 nanometers, but they would be shorter, and they can be exposed to the skin, exposed to your eyes, and not bring any harm. So it can be kind of like the lights in here. You could just screw them into and clean the air. Do you know anything about the development of that?
Yes, I do. Thank you. You've done your homework, obviously, Congressman. We're talking about what's called far UVC, and that is currently being produced by sources that make 222 nanometer UV. And because of the shorter wavelength, it penetrates the skin to a much smaller depth. And there have been animal studies and one human study that I know of that shows that it doesn't cause skin irritation. So that would open up new applications where you could use UV on an entire room. I should say, though, that 254 nanometer UV produced by mercury vapor lamps, essentially fluorescent lamps, is highly effective, but you do have to keep it in the upper room away from the occupants.
So anyway, I appreciate that. I had one other thought. I noticed that you had in there that an 6 or 8 MERV filter, which is standard but kind of minimal, but still quite a bit effective, more than just something else. These little masks here, I don't think have the filter area of even them, and it says that particular MERV efficiency is not very effective. You need to get to about 13, which is a pretty thick filter, maybe around 6, 7, 8 inches or something in thickness. What do you think of masks?
Thank you. Another great question. Masks of the type that you might be wearing, a cloth mask, are most effective at blocking aerosol emissions. They are indeed not as effective as a N95 respirator at protecting the wearer, but by stopping coughs and sneezes from traveling long distances, and by substantially reducing the amount of infectious material that gets into the air, it actually greatly reduces risk. So if everyone's wearing even cloth masks indoors, it makes a big difference in the amount of airborne risk that everyone is subjected to.
Thank you very much. I yield back.
Thank you. Webster. Representative Larson, I left out the Mr.
Thank you, Mr. Chair. My first question is for Ms. Nelson. Since 2015, I and many others have called for a national aviation preparedness plan to ensure all levels of government, airlines, airports, and frontline aviation workers are better equipped for public health crises like we have. We've learned some lessons over the last year about being not prepared. What priorities would you include in a future national aviation preparedness plan?
So thank you very much for the question, Chairman Larson. And we actually learned a lot during the Ebola crisis, and we had an interface with CDC on lessons learned, and in our occupational space, how the best CDC guidelines can be applied to our workspace. The first thing that I would say is that it was very quickly a problem that we did not have a proper supply chain on the proper PPE for the people on the front lines. We did not have access. Airlines did not have access to get the proper PPE to protect crew and keep us safe. In addition to that, we finally got Osha training on bloodborne pathogens on board. I would say that crew members were at an advantage because we had training in the first place to be able to stop the spread or take actions that would limit the risk of the spread. First and foremost, though, we really need to make sure that we are coordinating immediately. We can stop the spread of communicable disease at transportation's door if we are doing the things that we need to do about identifying where these outbreaks may be taking place in the rest of the world, how we can get resources to be able to target that and try to contain that where those breakouts exist, getting information to transportation workers so that we know what to look out for, and getting that proper PPE on the lines to be able to protect ourselves and make sure that we're not carriers ourselves. And also doing screening at the airports and all the agencies involved in at the airports about screening and making sure that we're keeping problems on the ground. So those are the first and most important steps, but it really does require good information, coordination between unions, industry, government, and we've seen it work before. It can work even better now with the lessons that we've learned.
Great. Well, tomorrow I'll be introducing the National Aviation Preparedness Plan bill, and I'd encourage members to sign on to that. Again, Ms. Nelson, Reuters reported that a major U.S. carrier instructed some of its flight attendants, this was in December, whose coworkers tested positive to continue flying and just monitor their symptoms. Have you heard of any similar situations from your members since?
Yes, this is a problem that we see across the industry, and it's because of the very narrow definition of what exposure is. So CDC is defining exposure as 15 minutes in close contact with someone who has tested positive. And crew members are told to continue to monitor themselves and keep working and come in contact with thousands of people and cross state lines. We think this is a very a narrow definition that needs to be expanded because of the kind of context that crew members have with people in close contact in our workspace, but also serving people food, picking up their trash. So we need to be much more attentive to when those contacts have been made and the cases where we have found that someone has contracted the virus, and make sure that we are getting those crew members notified and into quarantine and supported with pay during that time.
Thank you. Professor Banfluth, I apologize if I'm mispronouncing, but in your presentation, in the backup material on guidance for air operators, you say, for various reasons, modifications to aircraft ECS are not recommended as short-term response to COVID-19 concerns, and emphasis, therefore, on operation measures should be the focus. Can you explain that recommendation, and are you arguing, as ASHRAE, recommending that we think longer term about the ECS systems in aircraft?
Yeah, thank you, Congressman, for the opportunity to clarify. that point. I think when I say that, it's in the context that I've already indicated that we believe that aircraft are generally the safest transportation environments available because of the high air circulation rates, the large ventilation rates, and the fact that air is recirculated through HEPA filters. So the point is that I think we have airborne transmission covered about as well as possible. And so what's left is close contact transmission, which is not really affected by the ECS, and contaminated surfaces to the extent that there might be fomite transmission. So that's why I think that in that particular mode of transport, that's probably the place to focus rather than further enhancements to technology. Although I would certainly be happy to see evidence that improving ECS would make further improvements in risk.
All right, thank you.
Representative Perry.
Well, thank you, Mr. Chairman. Thank all our guests for their time and testimony today. My conversation and question will eventually be to the President Pro Tem of the Los Angeles City Council. Joe, in your testimony, you highlight the impact of the COVID response on local budgets and revenue streams, particularly your experience in Los Angeles, and as you acknowledge, the economic harm was not uniform across the nation. Some parts of the country may be ready to move forward post-virus more quickly, growing revenues and expanding the local economy, while others take longer, and that's a quote. There are obvious reasons for these economic disparities that need to be addressed so that calls for state and local bailouts are put in the proper context. Certain states like California, Michigan, Minnesota, New York, and the Commonwealth of Pennsylvania, where I reside, imposed prolonged, widespread lockdowns on their economies that killed economic activity, gravely restricted their citizens' personal liberties, and eliminated their tax bases. These 5 Democrat-governed states shed almost 250,000 jobs in December 2020 alone. Other states like Texas, Georgia, and Florida, among others, kept their economies open to a much greater degree, allowing businesses to safely remain open and citizens to participate in the economy in a safe manner. And not surprisingly, these states are already recovering economically. 15 states saw job growth in December 2020 despite the virus resurgence. Importantly, numerous studies have demonstrated that lockdowns have no significant effect on the spread of COVID in a community relative to less restrictive approaches. This fact is demonstrated by the situation in Los Angeles, which has some of the strictest lockdowns in the nation, and yet LA County has the most cases in the nation, over 1 million infections, more than the next 2 highest counties combined. So given this context, can you please explain to us why the tax dollars of the constituents I represent should be used to subsidize ineffective, economically destructive restrictions on their personal liberties and create a moral hazard that will incentivize similar lockdown orders in the future?
Thank you, Representative, for your question. Let's be mindful that COVID can care less what color skin, how you pray, how you love, what size city you live in. COVID is deadly, it's a pandemic, and it's real. Here in Los Angeles, as you mentioned, sir, we do live in a global city. It's a dense city, and that comes with challenges. Truth is that last week I attended a funeral of a 41-year-old friend, David Lopez, who died of COVID. We bonded together over Dodgers and French Bulldogs. He came out of East Los Angeles to become a very successful man, raising a beautiful family. He was an asset to our city, his family, to our culture, to our workforce. He had an entire lifetime ahead of him. He should be here with us today, prospering in the richest country in the world. The fact of the matter is, cities are crying for help, regardless if you live in a city of 5,000 population or 5 million population. We are on the ground zero of this pandemic. We are proud that we are home to the largest inoculation site in the country, Dodger Stadium. We're supposed to be vaccinating 20,000 people a day, and that's not happening. Herein comes the local federal partnership that we are thirsting for. To bring the vaccinations to the city so that we can get back to recovery and get the American people back to work.
Thank you, sir. I appreciate your answer, which quite honestly wasn't much of one. And while I lament the loss of your friends and my friends and everybody's friends throughout this circumstance, you can't just go on failing to acknowledge there's a difference in the approaches and the effect of those approaches and require citizens from across the country to pay for inefficient, ineffective approaches that neither save lives, nor save jobs, nor save taxpayer revenue. And I wish somebody would acknowledge that. We understand your plight. We're concerned for you and all American citizens. Actually, we're concerned with all the world's citizens that are under this circumstance, but there's a better way of doing it, and simply being willing to pay over and over again for ineffective non-solutions doesn't seem a solution to me. With that, Mr. Chairman, I yield back.
I thank the gentleman. I'd refer him to an article today. It was either the Times or the Post. I know that's fake news, but documenting what went on in South Dakota with Governor Noem, a former member of Congress, I think on this committee, I can't remember, who took 0 steps, and they have one of the highest death rates in America. With that, I would turn to Representative Napolitano.
Thank you, Mr. Chairman, and thank our witnesses and the transportation workers for risking their individual health and lives to keep our nation moving during this pandemic. Councilmember Buscaino, you talk about the ports, over 30 ships outside waiting to be unloaded. The current challenge facing your workers, what is being done to prevent the spread, since a lot of them have been contaminated, and how it's impacting the efficiency of the ports and our greater economy?
Thank you, Representative Napolitano. Let's be mindful, as I mentioned, that 10% of our longshore workforce are out ill today because of COVID. Nearly 700 of our dock workers are out sick. Coupled with the fact that there's such a high demand, this is why we see over, and you've recognized this too, ma'am, we see over 30 ships waiting to come in to the port of Los Angeles and the port of Long Beach. Tests and vaccines, we need to prioritize. I'm working alongside the leadership of ILWU here on the West Coast. The Los Angeles City Council unanimously approved prioritizing vaccinations to our longshore workforce, our truck drivers that come in and out of our port complex.
But you don't have enough vaccines, right?
We just need the vaccines, ma'am, absolutely. We stand ready. We have the infrastructure in place. The fact that we are using transportation hubs, can you just imagine a longshore worker coming in to check in, get vaccinated, a truck driver coming into the port, getting vaccinated? They're already here working. Let's move on the vaccinations. We just need them, and we need them with urgency.
Thank you very much. Mr. Rivera, I introduced the Transit Worker Protection Act in NYCHART 2 last Congress, which required buses to install bus shields to protect the drivers. What are your thoughts on it, and what is necessary? How is necessary to build the protection of their drivers?
Well, thank you for that question. I believe they need to build a better workstation for all the operators, including the shield, with better filters, with UV lighting, so that all the circulation of the air can flow a lot better and safer environment for everyone, including the operators.
Okay, my suggestion, I don't know how many of you can speak on this, but to ask the manufacturer of the buses to incorporate, as was put forth by Professor Benforth, the ventilation systems, the air distribution systems, the filtration, the air cleaners into the buses, as well as the shields. Can anybody opine on that?
Well, that question for me?
Anybody?
Okay. Well, right now what we have is, the airflow. We get everything. I don't see them sanitizing these buses where they have these special machines where they do it on a daily basis. They do it periodically. So right now they just wipe down the buses, they sweep them, they mop them. But
what would you say of having the manufacturers do the new buses as they are purchased to incorporate all of these things?
Yes, we would definitely be on board with something like that. Have our own workstation. They have buses like that at the airport, at Orlando Airport. They had them where they just kind of close off to the public, and we're secluded our own workstation altogether.
Mr. Banfleth, Professor, we are looking at a virus that's mutating, and there are going to be new viruses coming forth. What do you suggest that we should be looking at for the future? In fact, saying that we may have control of this virus sometime this year, maybe, but since this a new virus is coming, what can we do to protect our workers?
Yeah, thank you for the question, Congresswoman. I think the thing I'd like to point out is that all of the types of control I mentioned will work on a mutation of the virus just as well as it works on the current strains. The real question is how virulent, how infective are these new strains going to be, and are the levels of protection that we have now that may be appropriate for the current strain of SARS-CoV-2 going to work on one that's 30% or 50% more effective? And I think we have to go back to the drawing board and look at whether further levels of protection, whether it's ventilation or filtration, are necessary in that case.
Well, that leads us to the N95s of whether they're effective enough or going to be effective enough in the future. Thank you, Mr. Chair. I yield back.
Thank the gentleman. I thank the representative. Representative Babbitt.
Yes, sir. Thank you, Mr. Chairman. In the early days of the pandemic, freight rates in the trucking industry reached historic lows. And while these rates are dictated by market forces, there are federal transparency regulations that require brokers to disclose certain documentation to the carriers that they work with. With the goal of transparency in mind, I want to ensure that these requirements are enforced by DOT and not evaded, ignored, or too burdensome for a carrier to comply with. Currently, FMCSA has opened up a variety of regulatory dockets to gather public comments regarding this issue. So with that, I'll direct my question to Mr. Pugh. Mr. Pugh, I know that this might sound like an obscure issue to most folks, but could you tell us a little more about the issues that your members have had in accessing transaction records when they're working with freight brokers? I understand that these are regulations that are supposed to provide trucking companies the right to see these documents. But from what you mentioned in your testimony, it doesn't sound like that's happening right now. And more importantly, how does this tie into our discussion today about addressing the needs of workers during the coronavirus pandemic? Mr. Pugh?
Yes, thank you for your question there, Representative Babin. It's much appreciated. And yes, you are correct. I'm sure many of you that were in Washington working last year remember the truckers all coming to Washington. And because these freight rates they just went completely in the toilet, I guess, for lack of better terms. Drivers were paid pennies per mile. This brought up to light in the FMCSRs, which are the rules that all truckers must follow and you can't exempt yourself from. Brokers, there is a rule in there that brokers 371.3 that they have truckers and all people part of the transaction are allowed to see what people were paid. So in essence, the broker or the trucker can ask the broker what they were paid by the shipper. That's the long and short of it. This isn't happening. Unfortunately, a lot of brokers put right in their contract that you exempt yourself. They're exempted from this regulation, and a trucker can't. Those who do not, they tell you that you have to come to their office, which doesn't work very well in trucking because, you know, I may be hauling a load from Ohio to New York, may live in Ohio, but the broker I received the load from is in California. So for me to drive from Ohio to California just to look at this paperwork is utterly impossible. I mean, especially a load that pays maybe $1,000. So we feel that we put a petition for this to FMCSA. We said that this could be done electronically. Broker carrier agreements are sent electronically, contracts are set electronically in this age that we're in now. So there's no reason this information cannot be sent.
Okay.
Pardon me. Yeah, just one quick thing. The one thing the brokers always say is that they sign non-disclosure agreements with their shippers. Well, they could easily have the trucker or the motor carrier sign these same non-disclosure agreements, so they cannot discuss what these rates are as well.
Thank you so very much, Mr. Pugh. And let me just also say that I commend the work that OIDA has done throughout the pandemic to fight for your drivers. And while many Americans included, some in this room, worked from home last year as truckers, continue to crisscross this nation to pick up and deliver items that we all need, including life-saving PPE and millions of doses of the COVID vaccines. And we would not be moving toward reopening this country, I think, if it wasn't for the essential work of your members. And I hope that you'll pass along our gratitude for their perseverance and dedication to their jobs. And I hope this committee will work with you in a serious good faith effort to help provide our truckers with the resources they need in a timely manner. So thank you so much. And I will yield back, Mr. Chairman.
Thank you, Mr. Babin. Mr. Cohen, you're next.
Thank you, Mr. Chair. The problem with safety procedures in public transit has been going on since the coronavirus was detected in our country. I think it was as far back as March, no later than April, but I think it was March that the chairman and others, including, of course, myself, started writing the airlines and the administration urging a mask requirement. The first couple of flights I went on in March, there was not only no mask requirement of the flight attendants, but they were talking right in our faces, and they were talking without any regard for masks. And there were people doing the same. The airlines finally kind of came around, but the Trump administration never did, and I commend President Biden and our new administration for putting this mandate in place. It's necessary for the protection of the public. When I got on my flight to come home after the insurrection at the Capitol on the 6th of January, I heard people getting on the plane when offered tissue for protection, say, take it, put it back in the plate that it came out of, and say, it's COVID hoax. I heard people walking down the aisle going, I guess we need to be 6 feet apart or we'll get in trouble. And none of the people who had Trump material on wore masks in the waiting area. So I don't know who can answer for the airports, but I know Ms. Nelson can answer for the flight attendants. Can you give me some examples of problems that the flight attendants have had with people who refuse to wear masks, refuse to accept, they have to accept, or remarks about the tissues, the cleansing, and any tell us about the airport. I was shocked at DNA. They made an announcement that you're supposed to wear a mask in the waiting area, but nobody got up and said a word to anybody. I could not find a seat in the waiting area without being next to somebody who was exposed to coronavirus. Ms. Nelson, if you could respond, and I appreciate your efforts and your work, and everything Rodney Davis said, I say double.
Thank you, Representative Cohen. The days immediately preceding the insurrection and right after were some of the most scary times that we have ever experienced in aviation. This was a new safety and security threat that we have never experienced. And typically when someone is acting out in an airport, swearing at other people, refusing to comply with rules, acting belligerent and even delusional, they are denied the freedom of flight. We were very clear that anyone who attacked our nation's capital and our democracy should be denied the freedom of flight. And we were right, because what we saw in the airports was we were not really prepared to deal with this. This was a bit of a mob mentality that took over. We are trained to de-escalate. We're actually trained to ask other passengers to help us contain any problems if we're not able to peacefully de-escalate the problem. But when there are so many people acting out, we didn't have the training or the resources to deal with this on our planes, and everyone was at risk. We had a situation on one flight. There are many, many stories, but where the flight attendants called the pilots, begged them not to open the door because they were fearful of people entering the cockpit and taking over. We had people who were yelling at other passengers, a group of passengers berating a Black woman and her baby on the plane. And people who were not complying, and the mask policies were a big part of this. Enforcing the mask policies did two things. One, we understood that there was a concerted effort not to wear these masks, believe that this is part of the political effort to push back. People thought this was about their personal liberties. I would relate this to the smoking ban. When people said that they wouldn't be able to last for 5 minutes without a cigarette, they didn't get to have exemptions because it was going to put the rest of us at risk. So we had to very, very quickly clamp down on these mask policies. We were just not prepared for what we experienced in our airports. I'm sorry that you went through that. The crews that I represent went through very scary times on board.
I'm about out of time. I'd like to get one other issue in for you.
Go ahead.
To respond to, and that's the middle seat issue. It's very discomforting to sit next to somebody in the what you used to call tourist. I guess I don't know. It's called steerage. To sit next to somebody who doesn't wear a mask. Should the airlines not keep those seats open regardless of cost?
Well, first and foremost, everyone must wear a mask, and you're absolutely right. Secondly, we can't properly socially distance on a plane, so while a middle seat provides some additional comfort, and as Chairman DeFazio noted, controlling how many people are on board will help with the number of people who are spreading the virus. But what some of the airlines have done instead of blocking the middle seats is they have put more airplanes up in the air so that the load factors are lower overall. You're not really experiencing that on the flights to DC because oftentimes those are the ones that are the highest capacity, highest demand. But there is more capacity in the airline industry that hopefully will give us some room to work with there.
Thank you, Ms. Nelson. Mr. Cohen, your time has expired. We now turn to Mr. Graves.
Thank you, Mr. Chairman. Mr. Chairman, first of all, there was a letter that was recently sent by Airlines for America and many other organizations indicating strong concerns, I think, with this concept that we're going to be testing all of the domestic airline passengers, and just indicated that airline travel has very low transmission rates, and it suggested that this was unwarranted. So, Mr. Chairman, I'd like to ask unanimous consent that this letter from A4A, as well as Ms. Nelson's group and others, be included in the record for the hearing. Secondly,
without objection.
Thank you. I have another UC Baton Rouge Airport Director, which I'm going to refer to his letter later, but would like to also ask that Mike Edwards, the Director of Baton Rouge Airport, his letter be included in the record. Similar sentiment as well as others.
Without objection.
Thank you, Mr. Chairman. Ms. Nelson, I'd like to ask you a question. So if you look at this suggestion that at some point you may have domestic travelers being required to, before they can get on a plane, to be COVID tested, do you believe that that's going to result in basically an inconvenience that will result in higher cost, disproportionate impact on those of lower income, and potentially even pushing some of those travelers to other modes of transportation like bus and rail that don't require testing, which ultimately would be less safe?
I believe that will absolutely be the result. We're not set up to do this in a way that can be convenient for everyone in order and be effective. So it would be a cosmetic change that would hurt the airline business and actually make us less safe because of what you're talking about and pushing them to other modes of transportation.
And likely, so we'd be making decisions that were less safe, at the same time probably increasing the demand for PSP support, so additional taxpayer dollars going out to try and provide assistance. Is that fair to say?
You are 100% correct. And as I said earlier, if this is in place, the furloughs that we've seen so far would be dwarfed by what would happen if this policy went into effect without us being able to properly make it work.
Great. Thank you, Ms. Nelson. Mr. Pugh, I'd like to ask you a question. I know that that some of these smaller independent operators were unable to access the Paycheck Protection Program assistance, the program under the SBA and Treasury that offered assistance directly to small businesses to cover payroll. Last year, there was legislation that was going to require increasing the minimum insurance coverage for trucks, even though I believe it was less than 1% of the actual accidents hit the cap already. There was an effort to increase it. Do you believe that in these times when truckers are unable to access PPP, suffering extraordinary economic injury as a result of the pandemic, that putting additional insurance requirements that, according to statistics, clearly aren't needed would complement or the economic recovery and sustainability for the trucking industry? Or do you believe that that would cause harm?
I think it would cause lots and lots of harm. Thank you for your question, Congressman. Yes, you are correct. There's all kinds of studies that show there's no correlation in safety and increased insurance. In fact, we feel that it'll have an opposite effect because most small carriers, they don't have the bargaining power as the big carriers, but they own the truck, they own the trailer. They are some of the safest people out there. By doing this, you're going to drive them out of business. Trucking is a penny profit business. No one's getting rich in the trucking business that owns a truck and trailer. It's a very, very tight profit margin business. These guys are already paying $10,000 to $20,000. If they put these increases in, we have no idea even what the charges will go to. They could double, maybe more. We figure the availability for insurance will go away. There'll be less carriers willing to write these policies. It's just, so who knows, that eliminates competition. So yes, this would be a detrimental effect on small business carriers and on safety for the highway, in our opinion.
Okay. Thank you, Mr. Pugh. I just want to thank all the witnesses. I appreciate y'all's work and input in terms of providing feedback and helping guide us as we move forward. Last quick question here, Mr. Chairman. Perhaps one of the PhDs, under President Biden's executive order on the mask requirement, it's unclear, particularly in Section B, where it makes reference to airports being required to enforce the mask mandate on airport property. For example, my hometown airport, they own lots of open land. They actually even have tenants that have very little to do with the airport. Do you believe that enforcing mask mandates on open land when folks are not surrounded by other people or in private businesses that are not aviation related necessarily makes sense and should be part of this order if as strictly interpreted? If you could quickly answer.
I think that'll be a yes or no answer, and we'll move on.
Yes.
So that was a yes.
All right.
Just heads up for everybody, Mr. Series is next, then Mr. Bost, and myself, and then Mr. Lamafa. So if you get ready for your questions. Mr. Series.
Can you hear me?
Yes, we can.
Look, I represent a district that is one big transportation hub. I represent Hoboken, New Jersey, which is 1 square mile, and it has about 52,000 people. Every kind of transportation system you can think of is in my district. From the ferry to the buses, jitney buses that don't pay attention to the local rules, you name it, we use it. Because we are by far the most densely populated square mile in the country. I had the opportunity to visit one of the garages, the ATU, and the stories that I heard broke my heart. How people just don't pay attention to wearing a mask, to doing the right thing. I don't know what kind of technology we can use to protect these drivers and these people that are performing such a vital service. Because if we didn't have transportation in my district, I mean, it will come to a standstill. And my concern is what actually works for these people. I know we talked about a shield, we talked about the air, we talked about, but They're not comfortable with that. And I don't know how we make them comfortable to do their job. So,
Oh, good.
you know, anybody want to take a shot at that?
Everyone's healthy.
You know.
Well, Congressman, important point, and I'd be happy to say a couple of words. I think Dr. Michaels talked about the hierarchy of controls, and what that illustrates is that we have layers of protection, and they all add to one another. So what I would hope to see is that everyone does everything reasonable they can to reduce risk, and that's going to give us the best result. Honestly, we're in a situation of imperfect knowledge, but we know all of these things that are being recommended do something to reduce risk, and I think it's helpful to do as much of that as we can. We need everyone to do their part.
Does the National League of Cities, are they able to provide us with information on how many cities with public bus systems have protective shields installed in the buses?
Congressmember, yes, thank you for the question. Here in Los Angeles, in the LA Metro, we do have installation. We have installed shields in our bus fleet. As far as data is concerned with National League of Cities, we don't have that specific data now, but we'll be more than happy to provide a written report for you, sir.
Thank you. You know, I wrote Amtrak coming here this week. I have to tell you, I was one of two people in the car. And my concern is, once we hopefully get this pandemic under control, how are we going to get people back into trains that is so important, especially in this corridor that I travel in? I don't know how we get people confident to go back. It'll take a long time. I think Amtrak is losing something like $200 million a month. Some ridiculous number. But, you know, you cannot do without this kind of transportation. And I think part of our job as Congress is to find a way to bring back that confidence of people to ride the train, to ride the buses. I don't have any questions because most of the answers have been answered that I wanted to ask. But my concern is the confidence that we are going to be able to install people to go back to using public transportation. Like I said, my district is nothing more than a transportation hub.
Congressman, if I can respond, I think that the first thing that the country really needs to do is to change the culture around masks. The number one effective tool is to make sure everyone is masked. And if we want people to be able to get back on trains, on buses and planes, they have to have confidence that we'll be safe. And you know, in other countries, they issue tickets, like a traffic ticket, if you don't wear a mask. You know, we think it's just voluntary here, but you know, it's not voluntary to ride the bus without paying. There are certain responsibilities we all have, and certainly masking in public is absolutely a responsibility. And I think it's irresponsible to tell people, well, masking is just voluntary. It's something you can do if you want to. It's a public health concern. You're not masking to protect yourself. A lot of people say, I'm masking. I don't need to wear a mask because I don't care if I get sick. That's not what it's about. You're wearing a mask because you respect other people. You want to make sure other people don't get sick. And that's what we need to be talking about. I think everybody needs to get behind that message and make it strong.
Well, I agree with you 100%. Now we have people that have the 2 shots of the vaccine and they feel they don't have to wear the mask.
Mr. Series,
So, you know,
could you please wrap? Your time has expired.
thank you.
Mr. Chairman, if I can answer his question really quick, Mr. Rivera?
Yes, go ahead quickly.
Okay, I think that the industry needs to rebuild the buses and perhaps work with unions and help redesign them so that we can have a better feeling and understanding of what needs to be done. Thank you so much. And thank you, Congressman Series.
Thank you. And now turn to Mr. Post.
Thank you, Mr. Chairman. You know, recently the Federal Highway Administration released the results of a 2019 Jason's Law survey, which examines truck parking shortages nationwide. And this was an update from the FHWA's 2015 report on the same issue. And it was confirmed that the truck parking shortages are still a major problem in every state and region. In fact, some states, including Illinois, now have fewer public parking spaces than they did 5 years ago. That being said, Mr. Pugh, as a trucker and the firsthand experience out on the road, could you talk a little bit more about the safety challenges that the parking shortages created for drivers, especially during this COVID-19 crisis?
Yes, thank you, Representative Boston. I thank you again to yourself and Representative Craig for going across party lines and come out with such a good bipartisan bill to help truckers get some parking. So thank you very much. We appreciate that for both you and Congressman Craig. But yes, you are correct. I've been traveling to Washington, D.C. personally since 2005, attending meetings, hearings, surveys, discussions, and everything about parking. Since 2005 until now, the only thing I've seen is less parking than what there was in 2005. So the Jason's Law survey of 2019 is no surprise that there's less than there was in 2014, and this is still an issue. Myself personally, I can speak. I've had to park in places where my truck has been hit, where my truck has been tried to be broken into, where I've been harassed. I used to always carry a collie dog with me, one for to give me some company, but mainly for protection. I've parked in places where I've had my tire shot out. One of the worst stories I can relate to, and we hear all the time that the truck stop industry can handle all this. That isn't true. I was going to Boston one time, was getting sleepy, still had plenty of time, but I was getting tired. So coming into Connecticut on I-84, I started looking for a place to lay down and take a nap. This was later evening, probably 9, 10 o'clock at night. I stopped at every truck stop in Connecticut on I-85, which at the time I think there was 2 or 3. Ran through every rest area. There was no places to park. Got into Mass, same instance. Before I got on the Mass Pike, there was a couple of truck stops, nowhere to park. Finally, I got on the Mass Turnpike, got to the first service plaza. By now, it's probably close to midnight. Pulled in there to see if I could find a place to safely rest. The truck side was full. The car side there was some parking on the car side, and there was a couple trucks parked there. Back in the back. I personally backed in there and parked with those other trucks. At 4 o'clock in the morning, I was awakened by Massachusetts Highway Patrol, given a parking ticket, and told they weren't concerned that I was going to run out hours. They sent me down the road and told me to get on out of there. So this is a real problem that continuously gets worse and worse and worse. Truckers, during COVID, Pennsylvania shut their rest areas down. We had to get Federal Highway and some involved to get the rest areas back open. There's just not enough places to park. There's so many trucks, and with ELDs and all the hours of service and flexibility, it's just everything's maxed out. Government has to get involved. Congress, you have to help by passing something like Representative Boss' bill.
Well, thank for that, but also you just, and we've only got about a minute, but you brought up something that's vitally important that our committee needs to know and understand, especially those that have never been in the trucking business. And that is, it is the hours of service and it is the electronic logbooks that are putting us in situations. And then you have police officers, God bless them for what they do, but maybe a local community police officer that doesn't understand that when you say you got to shut that truck down, you got to shut the truck down according to the federal laws. And then the local laws will say, no, you can't park here because you're violating the law by parking here, but you don't have any more hours to go anyplace else. And it's a real problem that people need to know and understand. So thank you for bringing that up.
And if I could add, it's not only a problem with law enforcement, it's also a problem with these shippers and receivers. Some of these huge shippers and receivers have huge parking lots, plenty of place, but they make you leave. And
that's correct.
After they've held you up for 4 or 5 hours waiting to load, when they should have loaded you in an hour and got you down the road.
That's correct. With that, I yield back. Thank you.
Thank you, Mr. Bost. Heads up, the next three witnesses or questioners will be Garamendi, Lamafa, and then Hank Johnson. So I'll turn to myself for the next few moments. Like the Chairman DeFazio, I have the pleasure of living on the West Coast. I also have the pleasure of spending 5 hours going either east or west in an airplane. And so the question of air quality on the plane is of utmost interest to those of us. And I see our friend from Hawaii here, and he gets to add another 5 hours to that trip either way. So air quality becomes very, very important. Last year we introduced legislation on air quality. It was specifically for toxics. We now deal with viruses. And so my question goes to Ms. Nelson as to is legislation useful and necessary to mandate that the airlines provide airplanes that have systems to make their air safe from toxics as well as from viruses or other pathogens. The same question will go to Mr. Bonnefeld.
Yes, so we do need legislation on sensors and filters to make sure that we are not circulating toxins into the cabin air. But I do want to note that the HEPA filtration on board, not all aircraft, but many aircraft and certainly on Boeing aircraft, is helpful because it does at least filter out those virus particles. Now, that's not a complete protection. We have to have all the layers of safety, but air circulation and air filtration is a key part of keeping people healthy and safe on board.
Thank you. I look forward to your continued support of the legislation. Mr. Bonnefeld.
Thank you.
Yep, thank you for the question. And I have to say that as a representative of a technical society, it's not really, I think, my place to say how things should get done, but I do believe that our standards should continue to improve. And I would like to see standards like ASHRAE Standard 161 that relates specifically to aircraft air quality is adopted as the basis for design of aircraft in the future to the extent that it's not already being used. So I believe in standards produced by consensus bodies being widely adopted.
Thank you. I would appreciate from your organization specific recommendations on HEPA filters, UV, and other kinds of filters and systems that might be used on aircraft and also on other modes of transportation. We talked a lot about buses and trains here. So what can be done to improve the air quality? I'll also note that in this building, the architect of the Capitol decided that they ought to put in windows, new windows that we cannot open without the proper ventilation also. But that's a problem here. So if you would do that, sir, I would appreciate it. With that, I have completed my questions, and I'm going to turn to Mr. Lamafa. Mr. Lamafa, if you're still there. If you're not, we will go to Mr. Stauber.
Thank you very much, Mr. Chair. And I do want to thank the witnesses, and I also want to thank the industries who are testifying, our flight attendants, owner-operator truckers, and our public bus operators. And I appreciate this hearing today because I think it really has been the American worker who has proven to be more resilient than any virus could. And I have personally seen some of the best of humanity in the American worker since the beginning of this pandemic. I agree that we must protect workers from COVID by ensuring that they have proper PPE and proper policies in place to ensure that people are safe. But protecting workers from COVID not only means protecting them from the virus, it also means protecting their jobs and their ability to make a living. Mr. Pugh, how important is it to your industry that the businesses that drivers deliver to, the restaurants, the retailers, the supply chain partners, remain open for businesses and consumers who patronize these businesses?
Yes, thank you for the question, Representative. And yes, you're correct. It's very important. I hate to say it's life and death, but when you're in a truck and you're out on the road, I can speak for myself. You leave your home on Saturday, Sunday, or Monday morning, and you don't get back till Friday. Maybe you don't get back for multiple weeks. You know, a lot of guys, some guys can fix things. You know, they microwave stuff like that in your truck, but you know, ride around in a freaking box that's 6x6 or something and spend your whole time in there. It's nice to be able to get out and go in somewhere and not only wash your hands and stuff, but be able to sit down in something that doesn't move and eat a good meal, get a good square meal, not something you have to heat up in a microwave. Fortunately, thank God I was here in this office and I didn't have to go through all the things that our men and women driving truck are going through, have been going through and still going through. But like when I went back to Ohio from Missouri this spring, you know, we stopped in Effingham, which is a big trucking hub. All the truck stops had the restaurants open. I had my pickup truck and trailer. We actually walked to a fast food restaurant. They handed us food out the door. You know, it's cold, it was raining. That's the real thing that drivers have went through and are still going through in some places. A lot of places are still not opening. You can't park a tractor trailer at just any little restaurant that may be open.
Yeah,
in a district.
Yeah, Mr. Pugh, if I may, another question. So when you have individual governors unilaterally shutting down their states, what does that do to the owner, operator, trucker, and their bottom line?
Well, it kills their bottom line because once you shut them down, not only do they not have a place to stop or a safe place to or get a good meal or a safe place to be, it also shuts down freight that some of them haul, so they don't have any money. They're not moving anything or hauling anything. And they put tighter demands and stress on the other freight that's out there and what other operators are doing, which drives down costs for everyone, or pay, I should say, not cost.
Right. Well, thank you, Mr. Pugh. And, you know, we currently have an economic environment that is very fragile. Everyday businesses fear that the whim of a governor could shut them down for an indefinite amount of time, making it illegal to make a living, thereby again laying off employees and forcing American workers onto unemployment. In northern Minnesota, we also have the economic and personal safety of American workers in jeopardy due to protesters on the Line 3 pipeline replacement project. Just earlier this week, there was a protester who put people's safety at risk when he jumped onto a piece of pipe as it was being lowered into a water trench. Also earlier this week, more than 50 protesters climbed onto and under pipeline construction equipment, further endangering worker safety. Last month, protesters actually climbed inside portions of that pipe. More must be done to protect worker safety. I agree that the safety of the American worker must be paramount, whether it be from COVID, from shutdowns of small businesses, or dangerous protesters. Mr. Chair, I yield back.
I thank the gentleman. I'm going to, at this point, do something a little unusual. I'm going to ask that unless senior members have a pressing question that hasn't already been answered 2 or 3 times, to forego your questions, because we have a list that would go quite long, but we're going to have a series of 2 votes, which is a minimum of 2 hours. I will wait till the end of the first vote to go vote, but after that, I am not going to call the committee back into session.
Mr. Chairman,
yes.
Dusty Johnson, South Dakota, sir, and yeah, I would like just a couple of minutes to respond to something you said earlier, if I could.
Well, I just explained this problem, when your time is up for a question and you're up there, you can use it however you want. So with that, let's go to Mr. Johnson. Excuse me, Hank Johnson. Actually, the rules don't preclude Mr. We can use Mr. So Mr. Johnson, Representative Johnson.
Thank you, Mr. Chairman. And Mr. Pugh, I want to thank you for being here today and for your work representing small independent trucking businesses and independent truckers that catch a raw deal from the middleman trying to set the rates and get a fair amount of money for the work that they do. And I'm committed to working to level the playing field for you guys out there. So I look forward to working with you. In your written testimony, you expressed some frustration at this committee's efforts last Congress to raise minimum trucking liability insurance standards to $1.25 million. But you acknowledge that many carriers are already insured for $1 million or more. How much would it cost for an average carrier to purchase insurance coverage from 1 million to 2 million per truck?
Yes, thank you for your question, and I appreciate it. Yes, and to be clear, and I think you correct yourself again, they want to raise it 1.25 million, 750,000 is the minimum now. They want to raise it to $2 million.
And my question is, how much would it cost the average trucker?
Probably, we would guess that it would probably close to double. Average truckers are probably,
how much is
that would be probably $10,000 to $15,000, but there's no solid way to know because we're sure that there'll be insurance carriers that will drop out of this market. Commercial truck liability has been losing money for 10 years overall.
Well, now that may be true, but now you must admit that there has been an increase in trucking wrecks and injuries and deaths caused by them. And the basic $750,000 basement level has not been raised in decades.
That is correct, but most drivers, because of
let me ask you this question then: if there was no raise in liability and their families to adequately recover for their losses due to injury and death caused in trucking wrecks.
Representative Johnson, you're freezing up.
I think I can answer some of this, Mr. Chair. Yes, you are correct. There has been accidents and have went up, but there's also been studies that have shown by FMCSA that limits our average accident in trucks is 18,000 right now. We're around 18,000. 99.4% of all truck accidents, the limits take care of and cover. 750,000 is the required amount, but most carriers, due to markets, are already carrying $1 million. So again, it's been shown that these accidents, these catastrophic accidents, there isn't anyone who could supply enough insurance to cover them, unfortunately. But again, right now, 99.4% of all accidents are covered. This raising of the insurance minimums is completely driven by trial attorneys and wanting to get more money, because they get 30 to 40% or more of what these cases come.
I'd like for you to allow me to move on if I could.
Yes.
Not hearing Representative Johnson. No. Okay, well, I think we lost.
I'd like to thank.
Well, Representative Johnson, so we will move on to Representative Fitzpatrick.
Mr. Chairman.
You've only
Thank you, Mr. Chairman. Thank you, Mr. Chairman, for convening the hearing today. Thank you to our panelists. And my first question is for Ms. Nelson. I do want to share with my colleagues, as I'm sure many of you have, I dealt with a lot of our nation's labor leaders since the inception of the COVID-19 pandemic. And I can tell you that Ms. Nelson was so engaged from day one with me, with my staff, and so many of my colleagues, looking after the people that she represents and all people working across the country, including our flight attendants, including the airlines themselves. And I want to thank her for her service. So Ms. Nelson, if you are still with us, I've been a strong supporter of the payroll support program. And I wanted you, if you could, to share with the committee here what would have happened to the airline industry if Congress had not provided that relief. I think that's important for everyone to hear, given the need to ongoing support that.
Congressman Fitzpatrick, thank you so much. In March, if this had not been put in place, the airline industry simply would have collapsed. We would have seen many airlines going out of business. The drop off in demand was so severe, 97% drop off, that many airlines were in jeopardy of not meeting payroll within a couple weeks, if not within a couple months. So this saved the airlines and the ability to continue to provide this service for the American public and these jobs. But in addition to that, the payroll support program that we put in place was specifically a workers first program and supported only those workers' jobs, made sure that there was no cuts to hourly rates, made sure that we continued service to all the communities, and we did the opposite of what a normal corporate bailout would do. We capped executive compensation and banned stock buybacks. So it was workers first all the way around. It saved jobs, kept us connected to our healthcare, and all of the things that we need to continue for the rest of our working lives. Social Security contributions, contributions to our retirement and pensions. And these are things that we're not going to have to burden the rest of the public with, because Congress acted in a bipartisan fashion to put this Workers First program in place.
Yeah, I will say I strongly believe PSP needs to be extended to ensure that aviation workers have some stability during a really uncertain time. Ms. Nelson, if you could share with us what more can be done aside from extending the PSP to support those that work in the aviation sector?
We can make sure actually that we are implementing the 2018 FAA reauthorization bill, and that we are making sure that airline workers have proper access to PPE. So for example, flight attendants fill the 2-person rule in the cockpit when one of the pilots needs to come out. We also need those secondary barriers to keep us safe during this time. But we need to make sure that the flight attendants who are fulfilling that secondary person in the cockpit are able to have an N95 mask, because the pilots cannot always wear masks in the cockpit in order to properly communicate with ATC. So that is another thing that could be done, and that is a hole right now that needs to be filled.
Thank you, Ms. Nelson. Thank you for all of your support for the workers across America. You are a champion for them. If I could ask one question for Councilman Busciano. Sir, what effects will we see in towns and cities across the country if we do not provide the revenue necessary to stem the loss of revenue that you've experienced?
Thank you, Congressmember, for the question. We are dipping into our reserves here in Los Angeles, something that we've built up over the years since the last recession. We've also had to dip into our Public Works Trust Fund that we need to pay back, as I mentioned earlier, by July 1st per our city charter. And this is just the city of Los Angeles. If we don't move on a relief package for cities, towns, and villages across the country, we're going to start furloughing or laying off our essential city employees, from firefighters, police officers, to sanitation workers. Again, and I appreciate the question, because the cities are on ground zero in this pandemic. We heavily rely on revenues. The revenues are not coming in because of stay-at-home orders. Additional aid to local governments cannot come soon enough, sir. So many of our municipalities are facing devastating consequences because of the pandemic.
Thank you, Councilman. Thank you, Ms. Nelson. Thank you both for your service. Mr. Chairman, I yield back.
Okay, now Representative Johnson.
Thanks very much, Mr. Chairman. And I think we understand how critically important accurate and fair information is when we talk about COVID-19. And so I do want to take just a couple of minutes, I think, to set the record straight with some of the comments that were made that you made, sir, against your former colleague, Kristi Noem, my friend, and the governor of South Dakota. It was stated that 0 steps had been taken by South Dakota to address COVID-19. And that is simply not the case. I would note that in the earliest days of the pandemic, Governor Noem and our healthcare systems stepped up and made substantial investments in healthcare and in COVID response. And in fact, today, South Dakota leads the nation in hospital bed capacity per capita. Secondly, I would note that South Dakota has been a national leader week after week after week in vaccinations, routinely coming in as first, second, or third best in the country. The last time I checked, I believe South Dakota was fifth best per capita on vaccine deployment. For context, Oregon would be 20th. I would also note that South Dakota has a lower unemployment rate today than it did before the pandemic started. Now, so many of these concepts, vaccinations and healthcare capability, as well as employment, have been called out by our professional panelists today as critically important to how our nation responds in the transportation space. Now, it may well be, Mr. Chairman, that the steps that Governor Noem has taken are not exactly the ones that you would take. But I think all reasonable people should be able to acknowledge that they are not zero steps. And so I have been told that this committee is one of strong bipartisanship and cooperation. I believe that to be true. It is one of the reasons that I am so proud to have this be one of my committee assignments. But I would just note that hyperbole and dramatic overstatement is not conducive to addressing COVID-19. It is not conducive to problem solving, and it is not conducive to the work of this Congress. And so I thank the committee for their indulgence as I make statements related, I think, to some previous hyperbole and overstatement. With the time I have left, I have some questions for Dr. Banfleth. And I did appreciate, sir, your focus on science and standards. You noted in your testimony some cases of infection that contract tracing suggested happened on commercial air flights. But I want to provide some context around that data. Do we have any reliable data related to how many people have contracted COVID-19, sir, in commercial air?
Thank you for the question, Congressman. And that data may exist, but I do not have access to it myself at this moment. Would be happy to see if we can find that for you, or someone else on the panel may know.
So you note in your testimony that there is, quote, a significant risk of catching COVID-19 on air travel. How could one make that statement absent any sort of a comprehensive review? And I would only note this, sir, because I think other resources that I've researched, a study that MIT did an analysis of, indicated that it was, quote, highly unlikely to get COVID-19 on a commercial airline traffic. A Reuters source that I looked up noted that air handling in office buildings is about 4 times an hour. You talked a fair amount in your testimony, sir, about the importance of air handling. A modern jet aircraft turns over the air 20 or 30 times an hour. The World Health Organization, their recommendations for health facilities is that ventilation rate should be 6 to 12 times an hour. And so can you give me some sense of what data leads you to categorize the risk as you did?
Yeah, thank you. Happy to. I would categorize it that way because there are plenty of forensic studies on outbreaks associated with aircraft to document that it's possible to have significant transmission on an airplane. One that I mentioned but didn't go into any detail. I think there were 14 infections on that plane, and I believe 12 of them were in the business class cabin, all clustered around the index case who was on the plane. So I think that there is reason to believe that there.
Doc, I apologize. My time has expired. Doc, I apologize. My time has expired.
I'll give him an extra 30 seconds since you had to say something else at the beginning. Just finish your statement, sir, Doctor.
Mr. Chairman, thank you for your indulgence.
Yeah, it's simply that these numbers about how many out of total travelers is one way of looking at it, but the other is what makes people confident enough to go on an airplane or a bus or a train when they see what has happened in some of these incidents. And I think we have to keep working towards making them as safe as possible in every way possible.
Very good, Doc. And I would just close by noting we had 1.8 billion passengers in commercial airlines last year, And I would call out Sarah Nelson, I think, for her very good testimony, trying to balance the needs of that critical infrastructure with public safety. Thank you very much, sir.
Thanks, gentlemen. I just inadvertently recognized 2 Republicans in a row, so now I'm going to do 2 Democrats in a row, then we'll get back to regular order. However, I will indulge as a chair just for a moment. I apologize for the hyperbole about zero, but she did make a huge point of not wearing masks. You know, you do have the 6th worst death rate in the country, followed by North Dakota, your sister state. And the other 4 states have massive urban areas, which are like just hotbeds of infection. And then on my state, yeah, they're doing a crappy job on vaccine distribution and other things. They can't, the unemployment department's dysfunctional. I'm not going to apologize for those things, and I admit to that. They're doing better now. They are up to 20. They were down in the bottom. You know, we are 49th in terms of infections. And I think the same in deaths. And that's because we did a mask mandate, and Oregonians, for the most part, are compliant. Now, the only hotbeds in Oregon right now are Eastern Oregon, where the culture is more similar to South Dakota than it is to Western Oregon, where people are ignoring the masking and their rates are skyrocketing in these little tiny counties. Masks work. With that, we will turn to Representative Titus.
Thank you, Mr. Chairman. We've heard a lot this morning about making airlines safer and other modes of transportation, and I appreciate that, but 1 in 10 jobs in the country is based on tourism. Certainly the economy of my district is, so we need to make transportation safer. But this committee also looks at infrastructure, and let's not forget that part of our responsibility is oversight of 267,000 buildings in the federal real estate portfolio. And we need to worry about keeping them safe for the workers there, as well as the clients who visit. On January 21st, the president issued an executive order calling for government agencies to develop some guidance regarding air filtration. I would ask our 2 professors who we've talked about air filtration on planes to give us some of their recommendations. What do they expect to see? What do they hope to see coming out of this executive order? And what other things can we do besides the air filtration system to make our public buildings safer?
I was going to give Dr. Michaels a chance, but I'll be happy to answer that question, Congressman.
I really defer to you and Ashtray on air filtration, so why don't you go ahead and I can always.
Well, yeah, thank you. You know, I think what we see happening is a recognition that filters that filter the air in buildings need to control particles that are known to have health effects, not just infectious particles as in the pandemic, but there's a huge health cost to inhaling a lot of PM 2.5. And so these filter upgrades that we're talking about being good in terms of reducing infection risk are also good in terms of having a very significant effect on other health impacts. So I foresee moving up perhaps as a standard to the MERV 13 in most buildings that ASHRAE is recommending now. It's already in Title 24 in California. So I expect more filtration, but the other things that we can do, I think air cleaners are really a big part of the future of sustainable indoor air quality. And that's why I was so strong on the point that we need standards. I would love to see some of these technologies that are emerging be things that we use every day so that we don't have to rely on ventilation and filtration as much as we do.
If I can just add, certainly agreeing with everything Professor Bonifant has said, is the investment that is required to improve ventilation filtration, is not just for COVID. I mean, we're going to be, of course, we need to be prepared for future pandemics, but also certainly we're seeing this immense increase in wildfires, for example, throughout much of the country, which has led to all sorts of other toxic exposures. We have people who are wearing masks in public for reasons other than COVID for the first time. And so we have to think about this. How are we going to be protecting the lungs, not just of workers, but everybody in the country? And this is, in some ways, a down payment for that.
No suggestions about spacing or occupancy or anything like that in federal buildings, distancing, shields?
Well, certainly during the pandemic, masks and distancing are important. One would hope that we don't have to maintain that perpetually once the pandemic has subsided, but that's not HVAC. I think that Dr. Michaels is absolutely correct. The resilience with respect to quality events is important, and ASHRAE's actually got a guideline committee now working on guidance related to wildfires. So that issue merges with pandemic. What do you do when you have something that's really out of the ordinary happen? And certainly COVID-19 is one of those events. It's going to change the way we design systems, I'm sure.
We have to keep in mind the power bill too, because the U.S. government is one of the biggest consumers of electricity out there.
Ergo the desire for air cleaners rather than more ventilation.
Thank you. I yield my time back to the chairman.
Thank you, gentlelady. And again, since we're going out of order, because we went out of order on that side, Representative Wilson. Okay, Representative Lowenthal. Come back to Wilson.
Thank you, Mr. Chair. And first, I'd like to ask unanimous consent to introduce a letter from the Pacific Maritime Association, the ILWU, the ILA, which is the International Longshores Association, and the U.S. Maritime Exchange, urging the committee to protect maritime workers. I want to return to that issue.
Without objection.
Thank you. I'd like to ask Councilmember Buscaino. Joe, thank you for your first of all, your clear testimony on the need to support our state and local partners during this crisis. Very well stated. But I really do want to follow up on an issue that you raised and Congresswoman Napolitano raised, and that is about the tremendous rise in COVID-19 and testing positivity rates at both ports of LA and Long Beach and what can do. You've pointed out, I think we know that state and local leaders have stepped up along with terminal operators, labor, port officials. But I want to know, what have they done at the local level to bring down this? And the second part is, what should we be doing in Congress and also FEMA administration? What further steps to ensure that the critical operations of the port continue? So it's what's been done and what can we do?
Thank you, Congressmember. First and foremost, I appreciate your friendship and partnership over the years, you along with my Congress member, Nanette Barragan, and collectively, the both of you have elevated the importance of prioritizing vaccines for our maritime workers. We stand ready, as I mentioned earlier. We have a cruise terminal that sits vacant today, unfortunately, but can work to vaccinate our longshore workers, our truck drivers. We stand ready for that. Let's be mindful, colleagues, that half of our goods come through the San Pedro Bay ports. Nearly half of our goods come through both ports of Los Angeles and Long Beach. That's what's being threatened today. Additionally, we are thankful for President Biden in moving forward a couple days ago on agreeing to 100% reimbursement of FEMA. But cities and towns and villages across the country still have to front load those dollars in a time where our budgets are stretched thin. So the importance of moving forward and supporting another COVID relief package that includes dollars for vaccines will help cities, towns, and villages across the country to urgently deploy these vaccines, very similar to what we're doing at Dodger Stadium here in Los Angeles, as you know, sir. And the news broke today in this morning's LA Times, there's 2 additional sites in LA County, particularly in the disadvantaged, impacted communities of color, where we'll be deploying more vaccine sites, which is great. We have the infrastructure, we just need the vaccines. Please pass that bill so we can get the vaccines deployed to our cities, towns, and villages across the country.
Thank you, and I yield back.
I thank the gentleman. Now, Representative Burchett.
Thank you, Mr. Chairman. It's a pleasure serving on the committee with you, sir, and I look forward to the bipartisanship I hope we have here. I actually, when I was in the state legislature, I was in the state house on the Transportation Committee, and my friend Steve Cohen was a senator, and we partnered together to raise the speed limit in Tennessee to 70 miles an hour. Actually, I believe I asked for 85. In the art of negotiation, I took 70. But oddly enough, the week that I did that, the prior week, I had brought Peyton Manning to the floor of the House of Representatives, and he signed autographs for everyone. And honestly, I think I could have passed communism that week in the state of Tennessee. So it wasn't. So if you drive for 70 miles an hour, you have Steve Cohen and Peyton Manning to thank as well. I have one question for all the folks. And I understand that COVID has resulted in significant health and economic challenges for transportation industries. But looking forward, what do y'all think the recovery would look like for you, and how can this committee support that in any way?
As for me and for trucking, moving forward, the one thing Congress needs to do is and working with FMCSA and probably FEMA, we need to come up with a good way for truckers to get vaccinated, especially right now with there being the two-step vaccine. Truckers leave home, they're going, they don't know when they're going to be back, so it makes them tough to get that second one. There are agencies out there, or places out there like St. Christopher's Fund, who's set up flu vaccines in the past. We urge Congress to maybe work with some of them, work with some of these to set up places either in rest areas or truck stops or something like that. Hopefully this Johnson & Johnson shot will come available soon. It's my understanding that's a one shot. And as far as the trucking community, for those who want vaccinated, that would be the best thing for them to use.
If I can add, Congress member, on behalf of cities, towns, and villages across the country, we encourage our colleagues in Congress to pass the COVID Relief Act, move on a long-term infrastructure bill that was promised by the previous administration but failed to do so. What better way to put Americans back to work in a time of a recession, in a time of pandemic, than to pass a long-term infrastructure bipartisan bill? Thank you.
Absolutely, we need that relief, and the continuation of the payroll support is so critical, not only for our financial security and to keep the airlines intact and people in their jobs connected to their safety and security credentials so that we can lift the economy again, but also so that people are staying on top of their bills, paying their taxes, and contributing into the economy in a way that supports our towns and cities. Is so critical. So appreciate the bipartisan support from this committee so much, and I can't overstate how critical that is. I'll also just reemphasize that a federal plan to have vaccine distribution in our workplaces is going to be a much more effective program for crew members and other airline workers than trying to have this done through the states and have people haphazardly try to get appointments. So that would be very helpful. Thank you.
Ma'am, I would hope during anything that we do at the airlines that we would put some caveats in there that were not put in during the banking bailout. And I would hope that the, for lack of a better word, the big shots that in the airline would not be able to receive that money. It would go to the working folks, like yourself, so some of your colleagues.
That is what we have done. And I have to say that being 80% unionized in the airline industry was very helpful because we had the power to make them sit down with us last March. They had to agree with us before they could come to you for a bailout. And it was truly workers first. It required that it only go to the workers. And on top of that, we capped their pay and banned stock buybacks. So this is the first ever Workers First program that also puts these executives in check. And thank you so much for supporting that.
Yes, ma'am. And also from the trucking industry, I know Pilot Oil is headquartered in Knoxville, Tennessee, and they have, they're all over the country, I guess the largest diesel fuel movers in the country. And I'll bring that up with them about the vaccinations. Mr. Haslam is a great citizen of our community, and I'll bring that up with him. I spoke with him earlier today. I'll speak with him later today and bring that up with him as maybe a suggestion. So thank you all. Mr. Chairman, thank you again, brother, and I yield back the 18 seconds remaining of my time.
I thank the gentleman.
Please use it.
Thanks. That was great. Is Representative Wilson back? Nope. Okay, Representative Lynch.
Thank you, Mr. Chairman. I want to thank all the witnesses. So together with Congresswoman Presley, I represent the Port of Boston, and we represent the Port of Boston, and we represent Logan Airport. So President Nelson, we appreciate your remarks on the airline industry, and also Mr. Buscaino, appreciate your concern about the port, the maritime ports, and I associate myself with Mr. Lowenthal's remarks. The way that the Trump administration configured this COVID response was really that each state would sort of do their own thing, and that, in my opinion, has not been helpful. In my own state, for instance, on the list for vaccines, some people are in, some people are out. So we're going through a process right now where the postal workers who visit every home in America and business in America 6 days a week, they are not being vaccinated. They are not priority, and yet other workers are. So I was just wondering if there's something we could do, especially with Chairman DeFazio. Is there something that we could do to just unify the response here in a way that addresses, the airline industry and the ports that are more, global in nature? And is there a way that we might be able to send a message to these states, all 50 of them, that people in the transportation industry should be covered because of the nature of the risk that they embrace? Just like we're fighting this fight on behalf of the postal workers, is there a way that we do a resolution that would send a message to these governors that we recognize the special vulnerability and the special role that our transportation workers embrace each and every day? So I'm not sure if any of our witnesses would like to expound on that or share their own thoughts, but I'd appreciate it. Thank you.
If I may, Ishmael Rivera from Orlando. With that being said, we were asking by providing $39.3 billion for the transit preservation and service of PPE, and quickly try to implement all essential workers to include bus operators to get the vaccine. But just like you stated, we deal with passengers coming on a bus every day, all day long, and they too, like postal workers, take things back home and visit every household in America, and they could possibly pass it on. So that would be my recommendation.
Congressmember.
Thank you, Ishmael.
If I may, Joe Buscaino here, from the East Coast to the West Coast. When we talk about the supply chain, the goods movement that comes through the Port of Los Angeles and Long Beach, they hit every congressional district. So common guidance moving forward from the federal government would be helpful on protections for vaccines and transportation workers. It's a global supply chain that goes across all state lines. That will be very helpful. I would also recognize my colleague, Congressmember Lowenthal. I would take a page out of his playbook, and my Congressmember Nanette Barragan, to motivate and encourage the federal government to prioritize the vaccinations for our maritime frontline workers. Thank you.
Congressman, if I can add to that as well, in addition to obviously giving the states and local communities more funding to do this vaccination, because they're desperately underfunded, I think we have to recognize that workers involved in interstate or local transportation and commerce don't necessarily stay in one location for very long. And saying to Massachusetts, for example, that every seafarer who stops in the Port of Boston should be vaccinated based on Massachusetts allocation may not be just. And so I think what you've heard from several of us is there probably needs to be a special federal program in ports, in airports, and other places that reaches out and vaccinates transportation workers in an efficient way in the limited time they're in that port or in that hub to get them vaccinated. And that's probably vaccination the allocation has to be taken off the top and used by the federal government.
I'll just add on to that very quickly, and thank you so much, Congressman Lynch, for your support on this. But there are flight attendants who have finally gotten their date to go get their vaccine. It happens to be the date that they're working, and there's no way to get off work, so they have to let that time pass by. So the federal plan would be better, but we also appreciate your efforts with the states to get them to prioritize that. That's all helpful.
You don't. The time is run out. Thank you, Congressmember.
Thank you, Mr. Chairman.
Lynch.
Thank you.
Next on the list is Congressmember Guest.
Thank you, Mr. Chairman. Mr. Pugh, in my home state of Mississippi, the trucking industry is extremely important to our local economy, where 1 in 12 jobs are directly linked to the trucking industry, and we have over 5,800 trucking companies, primarily small, locally owned and operated businesses. Those businesses were among those unable to access PPP and other resources that you described in your testimony. In your testimony, you discussed the limited amount of PPEs and the necessary resources your industry was afforded during the early stages of the pandemic as haulers across our country carried the needed supplies to frontline workers who themselves were left without. You also mentioned the challenge your industry now faces with access to testing and vaccine. On page 8 and 9 of your testimony, you say, truckers face distinct challenges when it comes to accessing testing for COVID-19. Most of the time, our members are out on the road, away from home, often for hundreds of nights a year. It is not easy for them to drop into their doctor's office for a COVID test if they are feeling sick. Similarly, workers are now concerned about how they will access vaccinations while continuing to work. For professional drivers who often spend several consecutive weeks or even months on the road to make ends meet, accessing vaccinations can be logistically difficult and economically disruptive. Few truckers know precisely where they will be from week to week. Mr. Pugh, I'd ask you if you could, one, expand on these issues that you talk about in your testimony, and then also answer for me how we as the federal government can help smaller trucking companies best address getting vaccines out to our constantly moving haulers.
Yes, thank you for your question. Yes, that is correct. I mean, trucking is probably one of the, if not the most transit profession there is. Guys not only don't know where they'll be week from week, they don't know where they'll be sometimes day from day. Truckers are around, different people at different times. A lot of times you don't even know who you are around. So that's why in the early stages of this, it was so important for truckers to be able to get this PPE so they don't spread, because by the time they did find out they had it, they might have been 5 states away 3 days ago. And who knows how many paths they crossed then. And there's no real way to even figure that out. The other big issue in the early stages of this was if a trucker did get COVID, one, like you said, it was very hard for him to get tested. 2, and if he did test positive, what do you do? I mean, you got to trap a guy in a truck for 2 weeks to make him quarantine where there's no food, maybe no restroom, no nothing. That you can't do that. It's impossible. And maybe he's too sick to drive home. So this is things that we have to think about federally, because I don't think we have this patchwork of states all over. Going forward, like I said earlier, we need to work with, whether it's truck stop chains, with the states, rest areas, transportation or whatever, to set up places where drivers can stop and get these vaccinations that they need to be safe, to be healthy. Like I said, truckers can't just stop anywhere. This Johnson & Johnson thing would be great. And one thing I like to remind people, I'm not saying a trucker's a frontline worker, but they are right there behind the frontline workers, supplying them with all the things that they need. So truckers don't stop. So they should be moved, elevated up to be right behind these frontline workers to get this vaccination.
Thank you, Mr. Pugh, and Mr. Chairman, I yield back.
Thank you very much, Congressmember Guest. I am the next person to ask questions, and I wanted to address my questions to President Sarah Nelson. President Nelson, you gave some very powerful testimony at the very beginning of today's hearing, and I didn't want to lose sight of that. You told the important and tragic story of a flight attendant who, because of furloughs as a result of the lapsing of the PSP program, because of furloughs, she didn't get furloughed, but she had to work extra, and she had to move her base of operations from Phoenix, Arizona, which is in my district. I'm the former mayor of Phoenix, to Philadelphia. And so she had to spend a lot more time on planes, putting herself at risk. And tragically, as you mentioned, she died from COVID last week. So first, on behalf of myself and all members of the committee, please pass on our deepest sympathies and condolences to the family of that hero, that flight attendant that passed away because of COVID. But I wanted you to maybe talk a little bit more about that, because we think of the PSP program as a program to help the American economy, to help American workers in this particularly critically important American industry, the airline industry. We think of it as a way to, it affects so many employees, and we want to support those employees to the best of our ability. But you brought up another angle on it that many of us don't think about. Frankly, I hadn't thought about enough, and that is, for those employees, if we let this lapse again, not only are many employees going to lose their jobs and be furloughed, but many will be put in positions of greater risk to their own safety. And maybe you could just take it from there and expound upon that, how the support for the PSP program is not just about the economy, but it's about people's health as well. President Nelson.
Yes, I really appreciate that. Got me a little choked up too. This is very hard, because when you get into a time of cost cutting, and we had the lapse in the payroll support program starting October 1st, we saw a great turn to cost cutting so that the airlines can try to cut as many costs, because they're still losing, the major airlines are still losing $30 million a day. So what that does is it puts stress and strain on the workers on the front lines, and you see that through all kinds of public health decisions that have that cost-cutting strain. And then you have business decisions like the one in Phoenix to downsize the base because there wasn't enough demand there, and that pushes workers out to other stations. You also have situations where the furloughs cause a ripple effect across the workforce. And in order to keep a job, it means moving your family several states away, or commuting more because you can't take your kids out of school or move them away from their communities or from your family base that makes everything work, because you've got parents or aunts or uncles who help out. So this absolutely, the stress and strain of not having the payroll support for the workers who remain on the job puts their health at greater risk and makes them have to actually shoulder a greater burden of cost when they have to make these decisions to move to other states to keep their job. So there is a ripple effect that hurts the entire workforce and puts them at greater risk for their personal health and what they bring home to their families.
We owe you a debt of gratitude for bringing tragic stories like that to the American people's attention, because we need to continue to build support for PSP. And your particular involvement, your leadership, I think has helped build confidence on both sides of the aisle that support for that critically important program is essential, not just for the American economy, but for the safety of the workforce involved. And we know that the current round will end soon. American Airlines has already announced they're looking at furloughs shortly after it would lapse. And so we look forward to working closely with you to make sure that we continue to ensure that this industry stays strong, but more importantly, the people who work in the industry stay safe.
Thank you. And I just want to add one other point on that, because it will lapse on March 31st, but airlines schedule 2 months in advance. So the uncertainty is beginning now. The mental health strain and stress on the workers who don't know what this is going to mean for them if Congress doesn't act soon to extend this, they are feeling that right now. They're feeling that uncertainty right now. And we have an increase in mental health issues and calls to our EAP. And we have people who have taken their lives. So the extent to which this affects people on the front lines and the timing of getting this in place right now is so critically important for health, not just with COVID, but for every other reason as well.
All right, thank you, President Nelson, for that clarion call, critically important. I'll yield back the rest of my time and now go to Congressmember Van Drew.
Thank you, Chairman. I'm honored to join all of you today on this House Committee on Transportation and Infrastructure, and I look forward to working with you. I did want to mention before I start some other points how much I feel for the small trucking companies. These are, men and women who work so hard day in, day out, breaking their back, transporting the goods and services and everything we need across this country. Without them, we would be nowhere. And they need to be lauded sometimes and thanked for what they do. They may not be considered a frontline worker, but they're darn close to it. And the challenges they have aren't only COVID. They have challenges, health challenges, life challenges, in the kind of work that they do and the kind of existence they have to have. So I'm proud to know some of them, and I'm proud of what they do. South Jersey, where I'm from, has a tremendous need for infrastructure improvements, from roads, bridges, airports, coastal resilience projects. My home is also home to the William J. Hughes FAA Technical Center and the U.S. Coast Guard's Training Center, Cape May, the accession point for all enlisted that are going into the Coast Guard. Both facilities are authorized through this committee. I look forward to working with my colleagues to modernize the infrastructure of South Jersey and the United States, both for the FAA and the Coast Guard. For this hearing, I wanted to specifically focus on how COVID affects air travel. COVID presents safety concerns for both passengers and air travel workers and threatens tens of thousands of good jobs and lifestyles. The solution to this problem is to embrace the American spirit of innovation and adapt to change. So I want to take this opportunity to advocate for my own legislation, the Health Smart Air Travel Act. My bill creates a program to develop and standardize technologies to mitigate COVID in airports and passenger aircraft. This bill has broad industry support, including Airlines for America DEX, the Coalition of Airline Pilots Association, the National Air Carriers Association, the Aerospace Industry Association, Airports Council International, and U.S. Travel. The Health Smart Travel Act is bold, it's innovative, it's active. Our country needs to adapt and to overcome COVID. It will create a safer air travel environment for workers and for passengers across the United States, and I sure hope this committee takes it under very serious consideration. I direct my questions to Ms. Nelson and Dr. Blandfleth, and I think I know the answers, but I'd like to hear them again. Does COVID itself create a need to adapt a new, novel, different air travel infrastructure with new technology?
Congressman, I'll just say yes, and it requires innovation from this country. We have led on aviation around the world since its inception, and we look forward to working with you to make sure that anything that is put in place takes into consideration how it will affect the workforce.
And I appreciate your support for the bill as well.
Thank you.
Yeah, thank you, Congressman. I absolutely support the need for innovation, but at the same time, noting that there is a lot of existing technology that isn't utilized yet, and also that air travel safety starts on the ground. And so it's ground facilities, it's the planes, it's the transportation that gets you to the airport. So I think we really need to look at this comprehensively.
Thank you. Should the federal government work with stakeholders to stimulate the development and implementation of such technologies and identify best practices to set national standards? And the reason I ask these questions because, and it was just alluded to a moment ago by Ms. Nelson, America is, she didn't quite say it this way, but I'm going to say it this way. America's always been number one. We're number one in everything. We should be number one in everything. We need to be number one with this, and we really need to go forward and remedy this situation. And it's complicated. It's complicated when people are waiting to board an aircraft. It's complicated in the aircraft. It is a situation that I don't have to tell any of you doesn't lend itself easily to a cure. But I ask real quickly, do you think we should work together to identify best practices to set national standards?
All right, we're out of time, so that's a yes or no question.
Yes.
Yes, all right, thank you very much.
And if I could have the response for the record, I'd appreciate it.
Thank you very much, Congressmember. The next will be Congressmember Wilson.
Thank you so much, Mr. Chair. Thank you so much. And thank you to our witnesses for your testimonies today. It is imperative to me that we recognize and thank transportation workers across our country, across the nation. In the face of a devastating pandemic, they have been at the forefront of efforts to keep our economy going, and we thank them. Congress must ensure that our transportation workers are empowered to safely perform their duties. So I'm committed to working with my colleagues on both sides of the aisle to achieve this goal. With that, I will begin my questions. Mr. Rivera and Ms. Nelson, I want to personally commend you and your fellow transportation workers for your service during the devastating pandemic. In your testimonies, you highlighted the dangers that transportation workers face enforcing mask mandates, including physical violence and verbal altercations. This has been apparent in my own community when a Miami-Dade bus driver was spat on by a passenger. It is impossible to effectively manage this pandemic if workers feel unsafe enforcing COVID protocols. From your viewpoint, and I'm speaking to both of you, what steps should be taken by Congress and other government entities so that transportation workers feel empowered to enforce safety protocols?
Well, thank you for that question. And you are correct. That did happen in Miami. I was aware of that as well. We would say that here in Orlando, I can only speak from Orlando and other ATU agencies that I'm aware of. We need the resources so that they can support us, like in the airlines before, make constant announcements over and over. And not only that, but implement even at the local level. I'll give you an example. Speaking to an officer here in Orlando, he stated that before he can enforce and arrest anybody for not wearing a mask, he'd turn in his badge. I tend to disagree. So if certain individuals can do the job and help us implement it, then we have a lot on our hands. So I would say, give us all the resources, including law enforcement, to go out there and hope that they implement and strictly enforce these to make our job a lot easier. Thank you.
Absolutely. I want to echo that. And we need to make sure that when we are calling, when we have problems, that law enforcement is responding. But we can start with directives from the FAA, from DOT, for signage everywhere, for announcements in the airports. When we, after 9/11, we had Janet Reno saying over and over again in the airports, if you see something, say something. And everyone got the word. So we need to have that coming from leadership, and we're so glad that we have this leadership now from President Biden, from Administrator Dixon, and now from Secretary Buttigieg. But we also need to have this echoed in our airports and very clear for everyone everywhere, and then instructions to law enforcement that they must take this seriously too, and conclude the chain so that people know that there are severe consequences if they are interfering with the workers' ability to do our jobs to keep everyone safe, and certainly if they are committing physical violence, that needs to have harsh repercussions.
Thank you. And Janet Reno is from Miami too. So thank you. Acknowledgement.
Celebrate Miami.
Would you both support legislation that would expand or strengthen OSHA's role in protecting transportation workers from hazards like COVID-19 or workplace violence?
Let me just say yes.
Yes.
Okay. Mr. Michaels, as you noted in your remarks, an infection plan cannot be imposed by fiat. It must be continuously evaluated with the input and collaboration of the workers. If not, the plan is less likely to succeed. In my opening statement, I highlighted the importance of transportation workers feeling empowered to effectively perform their duties. Please highlight some examples of the implementation of an effective infection plan, either at the state and local levels or internationally, with workers' buy-in that Congress should use as a model.
Well, Congressman Wilson, you made a very important point. And there are plenty of examples around the country of unions that have gotten together with their employers and worked out a plan and said, we're all in this together, we're going to make sure that they work. And I can send some of those examples, and I know we don't have much time. But I want to also return to your last point that, the reason I think OSHA needs to play a larger role in this happening is that the transportation safety agencies, federal motor carriers, federal railroad, et cetera, don't really have the ability to either regulate or enforce these protections against COVID-19. The FAA has limited ones, and they actually agreed to let OSHA take those on that President Nelson talked about a few minutes ago in terms of the protection from bloodborne pathogens and dealing with Ebola. So I think what this committee needs to do is really encourage those agencies to think about how they can issue regulations and enforce them jointly with OSHA, which has a great deal more authority in this area.
Okay, thank you so much. Mr. Buscanino, I hope I pronounced your name correctly. Thank you for your
Buscaino, ma'am. Now you're half Italian. See that? Fantastic.
Thank you for your testimony.
Yes, ma'am.
Highlighting the challenges that cities face as the first line of defense in dealing with the pandemic. There is a balance that cities are trying between protecting essential workers and sustaining their economies. In my district, the Port of Miami is an important economic driver for South Florida. It is clear that the most effective measures, in addition to other safety precautions, be to vaccinate port workers, bus drivers, flight attendants,
I'm trying. The gentle lady is way over her time. Thank you. Thank you.
Thank you. Go back.
Congress member, we'd be more than happy to answer your questions offline.
Thank you.
You're welcome, ma'am.
Representative Steele.
Thank you very much, Chairman DeFazio, Ranking Member Graves, and members of committee. It is an honor to serve with you on the Transportation and Infrastructure Committee. I look forward to working with you to ensure that our constituents have a reliable modes of transportation and modern infrastructure and both safe and clean waterways. As a former chairwoman of the Orange County Board of Supervisors, by the way, we have 3.2 million residents living in Orange County, I helped manage our local freeways, buses, and wastewater infrastructure. During the height of COVID-19, I worked with state and local officials to make sure that our communities and transit systems had the resources they needed to keep people safe and healthy, like hand sanitizers on public transit. I also know how important it is during these uncertain times to support small businesses and preventing further increases to unemployment. I have a unique point of view on this committee as I come from a background dealing with the pandemic and transportation issues on a local level, and I'm excited to keep this dialogue going. I just have one question to Mr. Pugh. You mentioned in your testimony that Congress could temporarily suspend the federal diesel tax. What would happen to the trucking industry during the pandemic if Congress increased the federal diesel tax, and how would that affect distributing items to our local community, that local communities have been suffering so much for almost a year now?
Yes, ma'am. We would like to see the diesel tax cut during this, when the rates dropped and everything happened. we recommended a temporary doing away with that for the time so that we gave truckers a break. OIDA, I mean, as far as supporting an increase in diesel tax, has always been in favor of that when it's needed because that is the fairest, most equitable way to fund for highways. We understand that the Highway Trust Fund is going broke and the money has to be increased. And, you know, we would like to see it via fuel tax, not via some of these other things that we see, such as tolling or VMTs and some other issues like that. Again, fuel tax is already set up. It works. It's collected at the pumps. So it's a very good system and it's fair and equitable. If it was to be increased either here after COVID's dying off or in the future, the only thing we ask that it is raised fair and equitably between diesel and gasoline.
On a separate note, which states, besides Missouri, denied truckers to eat hot meals at the rest stop? Is this still an occurring issue?
Yes, it's still a occurring issue. I would say venture to say there's probably more states than less that didn't allow this. I can have my staff, I don't know the exact number of states, but I can have my staff follow up with you on this and this issue and some of our concerns with that. But I mean, we were pretty much told by DOT here in Missouri that they were not going to allow this, and it was because truck stops don't want that to happen.
Thank you very much. Thank you, Mr. Chairman.
Thank the gentlelady. Representative Garcia.
Thank you, Mr. Chairman. Staying true to your suggestion, I will skip the opening remarks. Mr. Rivera and Ms. Nelson, given the job responsibilities that you already have, is it reasonable to ask you and other frontline workers to also enforce the mask mandate? And what additional resources are needed to ensure that passengers and workers are safe in our transit systems?
Well, good afternoon, Mr. Congressman. I would say my recommendation would give the resources so that we have those officers or additional perhaps supervisors who can ride. You know, we have a big, great area, have more supervision on routes so that when we call dispatch and we have some confrontation or any issues on the buses, that, you know, the companies always come back and say it's due to lack of funding. So, but it puts us in the front line. And, you know, again, we're not the police officers. I have to look at my surroundings. I have to look at my rearview mirror to see if customers have their mask on. And it just gets a little stressful driving, you know, that bus down the road. So giving the resources to the authorities so that they can implement and perhaps get more involved in supervision, police, whatever they need to be doing to enforce this mandate.
We find that any new policies are best met when people understand clearly what's expected of them and what the consequences are if they don't comply. So as we step this up and we have law enforcement responding, that is very helpful. But we always say in aviation that the best way to keep us safe and secure is to keep problems on the ground. So it's very important to have clear signage in the airport, communications to passengers when they start at the ticket buying process, and then communications all the way through their travel experience right up to the airplane door. That would include also the consequences for not complying with that. When we have all of that backing, and then we have on the back end a response from law enforcement that is very swift and sure, people get the message. And people get the message, and it helps deter any issues where we are caught in the middle of trying to enforce this on board without any backing. So thank you very much for the question and the backing.
Thank you, Ms. Nelson. Dr. Michaels, on vaccines, there have been a lot of different approaches across the country to getting frontline workers vaccinated against COVID. I know that many of the transportation workers in my district are worried about getting COVID at work and then bringing it home to their families, which is why I'm glad to see the CDC has recommended that transportation workers be among the first people to access the vaccine everywhere. putting transit workers at the same level as grocery store and teachers. Everyone on this committee understands the decision without a healthy transportation workforce, we'll never get out of this pandemic. Dr. Michael, can you please speak to the reasoning behind the CDC's decision to prioritize transportation workers and the need to ensure that frontline workers are among the first people vaccinated, briefly?
Yes, Congressman, that's a really important question. The CDC, as well as several other organizations, the National Academy of Sciences, have all said frontline workers need to be prioritized because, first of all, they're the ones who need to go outside. They get to work. They can't stay at home like some of us and do their work on Zoom. They are at much greater risk of exposure. They can then expose others. They can bring the disease home to their families and to their communities. Many of them live in multi-generational homes and therefore exposing older people who are at great risk. The challenge we have right now is many states haven't figured out how to do this. States have said, well, we're prioritizing grocery store workers, transportation workers, but they still have to line up the same way, which means they've got to be able to get on the computer systems or phone systems to get into appointments. They've got to get, as you heard from President Nelson, time off to get the appointments. They have to be fast typists. If you go on these programs, when there are limited times that are open, if you're not there at the right time getting the information in quickly, you're just shut out. So I think what needs to happen is states have to step in and say, it's not just that we're saying these workers, meat packing workers, farm workers, grocery store workers, transportation workers, bus drivers, it's not just that they're in the front of the line, but we have to go and find them. We have to make sure we get the vaccine to them where they are, maybe at work, and then we should involve their employers and their union, or in the communities, because right now it's not working. The people who can get vaccines are white, middle class, upper class people who know how to work the computer system, and this is a real problem.
Thank you, Dr. Michaels. Mr. Chairman, I was going to ask another question about insurance and trucking.
I'm
but,
sorry, the gentleman's time has expired.
I yield back.
Representative Pappas. Okay, he may not be on right now. Representative Lamb. Not on. Representative Bordeaux. Representative Kaele. Turn on your mic. There you go. Go for it.
Showtime. Thank you, Chair, and it's an honor to be on the Transportation and Infrastructure Committee and to join you in the 117th Congress. We started off this hearing, and this hearing room was pretty full, and I can see now why seniority has its privileges. And, I've decided to sit here through almost 3 hours of this hearing because I not only sit here representing the 2nd Congressional District in Hawaii, but I also sit here representing 810 Hawaiian Airlines employees who all received warning involuntary furlough notices just a few days ago, of which 647 flight attendants and their families and 99 pilots and their families will receive those same involuntary notices. American Airlines will be issuing 13,000 involuntary furlough notices beginning tomorrow. And so this is something that I'm deeply concerned about. My question is for Sarah Nelson of the Association of Flight Attendants, and I mahalo her for being here today and for selecting her choice of background and reminding the nation that COVID-19 is a deadly pandemic that has taken over 400,000 lives, of which is Mr. Paul Frischkorn, the first flight attendant in the nation to die from COVID. And we send our thoughts and prayers to his family. My question is in regards to the payroll support program, because although we've discussed a lot of things today, this is what is most urgently on my mind. In 55 days, on the 1st of April, thousands of airline employees across this nation will lose their jobs, will be involuntarily furloughed. We saw how the country and the Congress supported the airline industry with $25 billion last March. And the result of not extending the PSP past the 1st of October resulted in 32,000 of those airline employees being furloughed. Congress in the 116th Congress appropriated $15 billion, but not until December. And that PSP will expire on the 31st of March in 55 days. So my question is for Ms. Nelson.
Like he said, was
The number we've come up with is something that's being debated here in Congress. And there are colleagues of mine that do not want to extend up to $15 billion of PSP to the airline industry. So my question is, what would be the ramifications of not meeting that number of $15 billion? How did the industry come up with that number? And how important is it for Congress to extend that $15 billion PSP in this next package and do it as quickly as possible? Because like you said, thousands of families and pilots and airline workers and frontline workers are experiencing anxiety and all the stress that they have as they await this potential involuntary furlough notice. So we need to avoid that. We need to act with a sense of urgency, and we need to get this done before the 31st of March. So I ask my question to Ms. Nelson.
Representative Kahale, first of all, welcome, congratulations. So glad that you are on the Transportation Infrastructure Committee and the Aviation Subcommittee with your expertise. It is urgent that we get this done, and it is urgent that we get this done before March 1st, because people are going to be making life-changing decisions based on whether or not they have a job and whether or not there are furloughs, because there is a ripple effect for the people who are still at work, trying to make ends meet, having to move to other locations to keep their job and the like. And the furlough numbers only start to tell the harm. It is also unpaid leaves that are forced on people to keep their health care. But what is also the ramification? The ramification is that Congress has to come up with more funds to support these workers, because the payroll support program pays a portion of the payroll. It is down from the $25 billion for 6 months that we had in March. We are talking about now $15 billion to continue that funding, or actually $14 billion, because $1 billion is for the contractors for 6 months this time. And if we don't supply this support for these workers, what we're going to do is push them to the unemployment lines. Then we'll be talking about trying to provide support for COBRA benefits, and we're going to be talking about the problems that this creates because we've lost that tax revenue for our cities and our locals, and that is going to have a ramification for our jobs in sanitation and education and postal workers and everything else. So then we're going to have to try to make up for the lost contributions to Social Security and the strain that that will put. This program has to continue for the people that this directly affects, and the stress and strain that they are under right now, and the transportation system that we count on and the infrastructure that remains in place when we have this program. But we also need to do this because if we don't do this, we are going to have a bigger bill for Americans to pay later. This is the best use of Americans' tax dollars to keep these people in their jobs with continued benefits, and it is the only Workers First program in all of COVID relief.
Thank you, Chair.
I thank the lady and the gentleman.
Mahalo.
There was just a little blurb on Reuters. Apparently, the White House press secretary enumerated the overarching priorities of President Biden in terms of COVID relief package. She was not detailed, and no one should take, Congress is an independent entity. So we are going to accomplish his goals and some of our own. And for some reason, the Reuters reporter, David Shepardson, if he's listening, I have not endorsed. I have been very vocal on the need for an extension of PSP, as well as aid to transit, as well as aid to private bus companies, as well as aid to airports, as well as aid to contractors, as well as aid to concessionaires at airports, except for the national chains. So with that, I've clarified the record. We'll move on. Representative Strickland. Nope, you're on. We can see you, but we're not hearing you. Hello, unmute. Unmute. Okay. We'll come back to her. This is,
It's just, okay, call on her again, see if we can get her to.
Representative Strickland, you are muted, muted.
Okay.
Well, you're having an audio problem then, so we will move on.
To, let's go to Malinowski.
Representative Malinowski. We'll move on to
Am I
Representative.
muted now?
Oh,
What?
there we go, we got her.
Okay, start over, start the clock over. You were not audible. Thank you.
Sorry about that. Hi, this is Representative Strickland representing Washington State's 10th Congressional District. Thank you, Chair DeFazio and Ranking Member Graves, for allowing me to be here today. And as a former mayor and a former board member of 2 regional transportation organizations, I know how vital transportation is to our economy. And I know that these transportation agencies don't work without the dedicated employees, and we must make sure that they are protected during and after this pandemic. So I'll talk about 3 things today: the need for local funding, equity, and what we can do with a national mandate. So I'd like to start directly with Council Member Buscaino, who is a city council member.
I voted on this.
And could you please talk about how direct assistance and 100%, can you hear me?
Well, they're down to you.
Hello?
Keep going, keep going.
Okay. So this is for the council member. Could you please tell us how direct assistance to cities and 100% FEMA cost sharing will affect essential workers in your community and across the country?
Thank you, Congress member. I speak on behalf, of course, National League of Cities, and one of your mayors, Mayor Victoria Woodard, is one of our officers, a second vice president representing Tacoma. And I appreciate the question. We are ecstatic and pleased as cities, towns, and villages to have that 100% reimbursement. If we did from FEMA, if we didn't, cities would be faced with furloughing of the city's essential workers, such as sanitation workers, public work workers, those who pave our streets and patch our potholes. For us, knowing that we'd get that reimbursement, we would avoid 6 months worth of layoffs and furloughs. And keep in mind, cities, towns, and villages, we don't print money. We are forced to balance budgets every single fiscal year. And that is, what we need to do moving forward. Without a COVID relief package, we're going to be dipping into reserves that we already have been in cities, towns, and villages already aren't seeing the revenue streams coming in. We heavily rely on tourism and trade, particularly here in the Southern California region. Both tourism and trade equate to 1 in 9 jobs. And when we can't get the ships unloaded quick enough, when we're not, it poses an economic issue. When we're not filling our hotel rooms, that poses an economic issue for cities, towns, and villages, because we can't move on our transit occupancy tax or TOT tax. So then we're forced to turn to layoffs or furloughing our most city essential workers like police, fire, sanitation.
Well, thank you very much. And now I want to switch to the conversation about equity. And I want to make clear that the virus is ravaging marginalized communities and disproportionately affects communities of color. And according to findings by the Urban Institute, more than half of all Black, Native American, and Latino workers have essential or non-essential jobs that have to be done in person. And they often have to use public transit to get there. There's a separate finding that also says that 1 in 6 Asian American workers fear receiving substandard health care because of their race if they become seriously ill. So for both Dr. Michaels and the council member, or anyone else who wants to answer, what safeguards do you recommend we put in place to protect workers of color in underserved communities? Thank you.
Well, I feel we need to pay them more. They are the heroes pay that you're seeing cities advance at $4 more an hour for at least 160 days. They are clearly essential workers. And I say those who are on the front lines, those people of color who are doing factory workers, janitors who are cleaning our hospitals, even more so our grocery workers, they need to be paid more. In addition, we are seeing inequities in the vaccine deployment. Recent New York Times article proved that there's more affluent communities in Los Angeles County who are getting vaccinated at a higher rate than communities of color. This is why we have partnered with our counties as well as a federal government to now expand our vaccination sites in disadvantaged communities, and we're proud of that. And this is what cities are thirsting for and demanding in every part of the country.
And I would add, beyond vaccinations, what is badly needed is a very strong workplace safety standard put out by Osha, but I don't think it should just be the one that Osha may be working on now. Congress needs to pass a law, and that was something that the House passed in the last session, needs to revisit, to expand it. OSHA doesn't cover all workers. There are millions of public sector workers in much of the country, not Washington State, but much of the country, who have no OSHA coverage. And transportation workers also are in sort of OSHA-free zones. So Congress needs to essentially pass a law requiring the federal government to issue strong enforceable standards to cover all workers.
Thank you.
Can I recognize, Mr. Chairman? I do want to recognize this committee who is, we have a number of former local elected officials like Congressmember Strickland and others. You understand where we are coming from, and local leaders make great national leaders, for the record. Thank you.
Thank you.
Well, thank you all for your remarks today. Much appreciated. All of the witnesses have been incredibly articulate. I now recognize myself, Congresswoman Marie Newman, for 5 minutes. So today, a little bit of a long day, so I have a couple of comments and then a very easy question for our witnesses. And I would agree with all of our witnesses, truly, on safety issues, safe parking for trucks, safety on buses, safety of our workers, furloughs issues and the credentials issues, air quality, and our cost issues and our economy. I'm largely in agreement with all of you. And interestingly, because I've done my monthly round of calls with ATU and CWA, all of our federal and local transportation agencies, as well as some of our private employer partners. So very familiar, interestingly, just in the last week with all of these issues, including safe parking for our independent truckers. So at the end of the day, I just have one question for all 6 of our witnesses. So in addition to all of the, I would say, proactive, reactive, and remedy ideas that you have shared today, which I largely agree with, would you also agree that at the root of all this, in addition to what you've said, is getting vaccinations to as many people as we can, as quickly as we can, and therefore supporting our cities, counties, and states is critically important? And then I'll just ask all of you to say yes or no. So I'll let the witnesses speak. We'll start with Ms. Nelson.
Yes, the problem is the pandemic. We got to rid it.
Thank you. And then I'll go to Mr. Pugh.
Yes, have to be able to take care of these people and get them the vaccines they need to get rid of the epidemic.
Thank you, sir. And then Mr. Rivera?
Yes, we need the vaccines as quickly as possible. We're easy to locate.
Great. And then
Thank you.
Thank you. And Professor?
Yes, we need to make sure that the cities and states and counties have enough funding and support to get these vaccines out to the people who need them most.
Great. And then I believe it's Councilman Biscano.
Yes, ma'am. Vaccines as soon as possible. Let's deploy. We stand ready. Cities, towns, and villages. Yes, ma'am.
So let's just be on record that largely all of these incredibly knowledgeable witnesses and this body writ large agrees that the most important thing is to get money to cities, towns, states, and counties so that we can distribute this vaccine more widely. And that those are my comments for today. And I'm going to go to recognizing Mr. Payne for 5 minutes.
Thank you, Madam Chair. Let's see. Professor Michaels, the current national vaccine distribution program depends on essential transportation workers remaining healthy and being able to conduct their jobs safely. While I'm pleased to see the Biden administration take steps to protect workers with transportation mask mandates, what other actions could be done to protect the health and safety of vaccine distribution personnel?
You know, it's the same. Thank you for that question, Congressman Payne. You know, it's the same issues that need to be protecting every sort of worker out there on the front lines. We know how to stop exposure to the virus that causes COVID-19, and you need, until you're vaccinated and even after you're vaccinated, you need to take a lot of steps. Masking is fundamentally important. Distance is important. Filtration and ventilation, disinfection. You know, this should be what everybody in the country is doing right now. People who get the vaccine everywhere are the same people who are moving buses, who are moving airplanes. They all need that protection, and that's what we have to be focused on. So the whole country has to make this the #1 priority, because only by making sure all of these workers are safe can we stop the pandemic and get the economy back to running again in a normal way.
Thank you. Ms. Nelson, our vaccine distribution system. I'm sorry, our vaccine system could not function without vaccines being shipped by aviation workers across the nation. In your testimony, you described the need for federal vaccine prioritization program, and that prioritizes frontline aviation workers. How would vaccine prioritization for frontline airline workers help to ensure smooth operation of the vaccine distribution system?
Well, first of all, keeping us in our jobs, we're part of the infrastructure that helps get these planes up in the air to get the vaccine distributed across the country to anyone who has those orders on file. So we are a part of making that happen. But secondly, having a federal program where we can have transportation workers vaccinated, and certainly crew members who are crossing state lines, will help to cut down the number of people who are most likely to be coming in contact with other people and spreading the virus. So we are starting to do contact tracing by doing that, and taking the priority of the people who are most likely to come in contact with other people, either contracting the virus or spreading the virus ourselves.
Thank you very much. Professor Michaels, unfortunately, there has been at least one incident of an employee that handles the vaccines purposely allowing a batch to spoil. While this was an isolated incident, and there have been no such reported incidents involving transportation workers, there is a potential for this threat to distribution networks as well. How would vetting these vaccination distribution workers protect other workers and the distribution system as a whole?
Well, Congressman, I'm not a law enforcement expert, but this is clearly a law enforcement issue. These vaccines are life-saving drugs. There is no question that destroying a lot of 50 or 500 of these means you're putting people at much greater risk for illness. And this is a significant law enforcement question. And I think we need to have federal law enforcement step in these situations. And that will obviously protect the country. We need this badly.
Thank you. Madam Chair, I yield back.
Thank you, Mr. Payne. So now I would like to recognize Ms. Bordeaux for 5 minutes.
Thank you so much. And I know it's been a long day. Thanks to all of you for testifying about how we keep our transportation workers safe. In my district, which is the northeastern suburbs of Atlanta, we have a very modest transit footprint, but nonetheless, we have lost transit workers to COVID. I know the ATU lost over 120 of its members since the start of the pandemic. In my district, a bus driver with the Gwinnett County Transit Service, died of this disease back in July of 2020. And his family believes that he contracted the disease while working because that was the only time he was really in contact with the public at large. After his death, ATU Local 732 advocated strongly for hazard pay, sick leave for transit employees, and a no mask, no ride policy to protect the transit workers and passengers. I'm pleased to say that because of the CARES Act that Congress passed, the Gwinnett Transit was able to implement a number of very important changes, retooling the buses and how they operated. That being said, we now face new challenges as we go into a new era of dealing with COVID. We have new strains and new concerns about how we protect our transportation workers. And in this case, one of the key areas of concern for me is the transit workers. So just a question for Mr. Rivera. Greatly appreciate you being here. How do we protect our transit workers? And in particular, this is a very small transit agency. It is not one of the big ones that I know a lot of you all here are involved in. What do we need to make sure is included in the next COVID relief package to help them deal with the new strains of the disease and to continue to protect them in the days ahead?
Well, thank you for that question. Again, I will say we too are a big tourist area and we get individuals coming from all over. We need to protect by getting us the vaccines, make it a priority. We can easily be located, just come to the hubs and have law enforcement monitor it, give the vaccines. I also had COVID, and it's scary that I go to work at 3:30 in the morning and I don't know, I got to come back home to my family. I don't know who's carrying this virus on the bus, co-workers, I don't know. Pass this bill and help us get all the resources that we need. We need to redesign these buses and protect everyone, from the air filters to the vents, whatever it needs to be done to protect not only the operators, but all essential employees, as well as the passengers that take the buses every day in, day out. Thank you.
Okay. Thank you so much, and I yield back the balance of my time.
Thank you, Ms. Bordeaux. And today, I thank all of our witnesses. It was a bit of a long day, and you all answered admirably. We all learned things today. Your ideas are excellent, and we appreciate all the great work that you're doing out there. I would like to make one final comment before I close, and that is I encourage all of our colleagues, Democrat, Independent, Republican, to think about what the root cause of everything is. It's the pandemic. And that if we can get more vaccinations out as quickly as we can, it only makes sense to support our cities, towns, states, and counties. So let's make sure that any bill we move forward has the remedies that our witnesses have suggested, along with support and funding. And finally, I will close. I ask unanimous consent that the record of today's hearing remain open until such time as our witnesses have provided answers to any questions that may be submitted to them in writing. I also ask unanimous consent that the record remain open for 15 days for any additional comments and information submitted by members or witnesses to be included in the record of today's hearing. Without objection, so ordered. The committee stands adjourned. Thank you, everyone.
Thank you.